Good evening. I'd like to call this meeting to order, the Town Council Budget Meeting for January 18th. Please stand for the Pledge of Allegiance. Pledge of allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Paul, you have some
Yeah,
business to take care
yeah, a
of?
little business to take care of. I want to do my one announcement that I do at every budget meeting, that if you have a petition warrant article, a petition bond warrant article needs to be in the town manager's office by 5 o'clock on February 9th. If you just have a regular petition warrant article, that needs to be in the town manager's office Tuesday, February 13th by 5 o'clock. The next announcement is really a discussion with the council a little bit. Next week is going to be a little bit hectic for the 7 members of the council with polling on the 23rd, and you'll be there from 7 till whenever. And knowing that we have a town council meeting on the 25th that I have to have because I have a couple public hearings that I need to have. I was wondering how the town council would feel if we take the budget discussion up on the regularly scheduled meeting on the 25th and we do not meet on the 24th, unless after tonight there is something that you would like to discuss further. This way, you guys would have at least one night off to recuperate before the next meeting to discuss the budget and things of that sort. Or if the council wants, we can do it on Wednesday, the 24th.
And
At
on
6
the 25th.
Thursday, and have the meeting on
Gee, what
Thursday,
a
the
difficult
25th.
decision.
So
The agenda for Thursday is actually very light,
very, very light.
so we can accommodate it, which is
Yeah.
what's nice.
I think I only have 4 things on the agenda right now. 3 public hearings that I have to have for a CDBG grant that a resident have brought forward, and we're working with the state on to help them out. And then one financial update for the second quarter financials, and that's basically all that I have on the agenda.
So
So
how does the council feel? Does everyone feel okay about consolidating everything on the 25th? Anybody against?
So the 24th was supposed to be a final budget review meeting?
yeah, we'd start the final budget review, but we could just do that during the council meeting on the 25th.
Since it's gonna be so
Okay.
light. You have a problem, you have a
I
concern?
mean, I don't have a real problem with it. I just would rather it stayed the way it was, but I'm one voice.
Okay, I guess you lose, Tom.
It's not the first time, and I'm sure it won't be the
No,
last.
I totally agree.
No,
And I know exactly how you feel. I think I would feel concerned too, but I know what the agenda is Thursday. And it's so light that I honestly think we can accommodate it. That's the only reason I don't have concern. Right?
yeah, well, it would be a very quick meeting on the 25th.
Right.
If we did keep it on the 24th, it would be a real quick meeting, maybe 15 minutes
Yeah.
on Thursday. I'm assuming, there's no changes to the budget. We're gonna move on and move everything to,
Well, you're the town manager. You should assume that, but
no, I do have some additional items that I want to bring forward that we've discussed, and now that we're further along in the budget process for other issues and cuts.
Well, perhaps because this is the final night of the actual budget presentation.
Correct.
I think if there are truly legitimate and more than minor discussions going to be had, maybe we should make that aware tonight if possible.
And I guess we don't have to decide right now. We could
No,
decide at the end of the
decisions
night
won't
on
be
this.
made. But I'm saying that if there are major concerns, perhaps they can be expressed. And if need be, we could do an additional time.
Yeah, we
Right.
the council doesn't have to make that decision right now. We can wait till
Correct.
the end of the night whether or not we're going to have it on the
Correct.
24th.
The very end.
I just wanted to bring it up as a possible solution for everybody.
Yep.
We can do
Agreed.
whatever you need. I'm here. It does, and the department heads will be here, whether it's the 24th or 25th as well. So,
24th was an optional meeting anyway.
Correct.
In case we needed one. Correct.
for snow date and to begin the budget review.
Okay, before I forget, I need to be able to tell you that the chair, Finley Rothaus, is excused from this meeting. Okay, we're all set to begin?
Yes, we are.
Okay, we're gonna start with welfare, which is tab 25. Pat,
So
come
Pat's
on
here.
down. Pat,
Pat's here tonight to discuss her welfare budget. And after Pat gets done her welfare budget, I'd respectfully ask the council if we could go back to general government under the line of Nashua Transit, because Pat has that information as well. So we can start with tab 25 and then move on.
go right ahead, Pat.
Okay, good evening. For those of you who don't know me, my name is Pat Murphy. I'm the Welfare Administrator for the town of Merrimack. This evening, I'm presenting the budget for welfare, and it seems like, in all things, this has been an extraordinary year in welfare and other things. But for welfare, we have to provide this assistance. It is a mandated state requirement. So whatever we budget for the welfare department for assistance is one of those things that we're always trying to gauge based on many different factors, one being historical factors, other programs and assistances that they provide. So we're always trying to make a guess of what we think we may need. And so unfortunately this past year we didn't budget enough, and we're really going to be surpassing our budget quite a bit this year. So in order to go forward for next year, we really, I did do a large increase for that, but not as much as probably might be needed. I don't know. It's at this point, when I was talking about it with the town manager, we decided to go with increases of 50% increase over what we had, even though what we're looking at right now and what we're using is very high, but it always is one of those things. It depends on many different factors, clients, the possibilities are not really concrete. So it's really hard to guess. So what we have here is a budget of $201,241, which is a 12% increase overall. The reason the biggest increase is in the general assistance line items, which, as I said, we increased all the line items except for the dollar marks where we hold sort of line items, but basically it's a 50% increase in the general assistance. These factors, also were something that we don't really, it's hard to judge, but there are some things in hindsight now that we can look at and say, what happened? Okay, well, we know rents went way out of control. And between just the last 2 years, we saw an increase of 18% just on fair market rents. And that's not actually market rents that are higher end units that have been in Merrimack. So that was a thing. But the big thing that's dictating that is like a less than 5% vacancy, our vacancy rate, which means that landlords really have the upper hand and can charge what they can get their units for. So that's one of the problems. The Emergency Rental Assistance Program, which was a federal program under COVID, ended last year in December, and they ran for about 3 years. So in our 3-year period of COVID, they were taking on a lot of the housing costs that we didn't see. And so this was one of the reasons we didn't really see this coming, I think, to us completely, because we didn't know exactly where the costs were in each individual municipalities. But also we just didn't know because of the fact that a lot of them were motel expenses as opposed to residential rent expenses, because homelessness had gotten out of really became epidemic during the last 3 years. And then we saw, of course, the utility increases last year, but that seems to have settling down a little bit. So this is where we are today. So we are looking at an increase just to stay above what we hope will meet the budget for next year. However, this year, I can tell you, we've spent our housing expense line item about 136% at this point by the end of December. So that shows you a little bit of how this overwhelmed us this year. So it is one of those things, that is hard to predict. Again, as I said, so it's hard to know what we will need to spend next year, but this is always my problem, is always trying to factor in all the unpredictable things. But a lot of it is also the clients themselves, and like I said, assistance programs that will satisfy their needs to go on, so that we don't have to assist them any further. But what we've been seeing is that we've been having to assist homeless, disabled people, mostly elderly, who just cannot afford to rent. They need subsidized housing, not even fair market rent housing. And so this is what we're facing is like 2 to 3 year waits for subsidized housing for people who are elderly or disabled. So this is the kind of problem that we're looking at, and the people that we're housing right now in motels are those individuals that I'm struggling with. The other increase is just a smaller increase in our social service budget, and that's based on just I got 7 agencies that did ask for increases. Some of them were really very high. So the total request was $163,649, and I did par it down to $83,293, which, giving those 7 agencies that did request increases, a 5% increase to cover their costs of many different factors. As we can imagine, there were many different factors for utilities and for food and things like that, and things that they cover. So this is basically the increases that are going forth in the budget. So if anybody has any particular questions, I'd be happy to handle those.
And I want to mention now, the line item of housing and rents and mortgages. In 2022-23, we spent $29,000. And this year we budgeted $38,323.24. That was roughly an 18 to 19% increase. Like Pat said, we kind of got hit with a couple, 4 or 5 people that are disabled, elderly, that need this assistance, and we cannot turn our backs on them. There are state laws about that. Pat tries to get them in wherever she can, and we're trying to get them into their permanent home. And the permanent home might not be anywhere near Merrimack. It could be as far away as the seacoast if there's availability. So Pat is trying to get these people into their permanent homes. But we have seen in the last couple of weeks an uptick of more people coming in who are homeless with service animals or other items that Pat's been working with. So I don't want the people at home think that, oh, you get on town welfare, you never get off. No, Pat tries. She makes the phone calls. 9:30 in the morning, she's on the phone with some of these, even the shelters. She's on the phone with some of these shelters saying, hey, do you have them? And if they have them, picks up the phone, says to the individual, we have a shelter available for you. You need to go. So, it's not a, hey, get on it and stay on it forever. Pat does try to get them off as quick as possible. It's just these 4 or 5 people. It's very difficult right now because of their needs to find them housing. And like she said, subsidized housing in the state is there isn't enough for some of these elderly people. Even though we are building apartments and workforce housing, it's not subsidized. So.
Yeah, and even though I talk about just the disabled people that I'm struggling with, trying to move them forward, I have been dealing with I had about 38 calls from homeless people in this past year. And so 38, some people we had to assist for a couple of days, some people until we could find a shelter, some people just a week, some people, like I had someone last week who was able to, I had never helped them, but they needed just first month's rent to get into a new place, so, there are different things that, and even though I'm struggling with these particular ones that I'm having trouble with because of their disabilities, they're very low income and elderly status. But yeah, we've been dealing with a lot more than just these individuals. So it is quite a variety.
Andy, did you have a?
Yeah, I want to clarify, we said at the end of month December, our housing line is 136% spent.
Yes,
Yes, we're overspent.
we're overspent.
And we have to go to end of June.
Correct.
So that puts us roughly at, from last year's budget, 52,000, and in this year's budget, we only have 57,000. Do
Correct.
we think that we're budgeting enough that, what I don't want to do is just go in and budget 57,000 and we know we're going to blow past that next year.
We're hoping that some of these long-term individuals between now and June will be off. The one thing is that because of the way this is set up, is that we'll have to find money in other departments to cover Pat's cost. The last thing I want to do is say, okay, we're going to spend $100,000 in housing rents and mortgage payments and spend 40, and then $60,000 is sitting out there that we could have used for other items. So we've talked about it. We thought by raising it, to 57, it was going to be tight. If 25,000 more, 75, I don't know what a good number is because we don't know day to day what happens. And the other thing is that people talk, and if they hear Merrimack has money for this, they try to come in on a Friday afternoon and try to get the housing for the weekend or try to do stuff. And this is where Pat's very good. And she'll say, all right, I need to see some information from you. I'll sit down with you and we'll go over all your financials to make sure that you do have a need. So to be honest with you, I'll let Pat answer that question. I don't know what the right number is. It could be 75, it could be 110 right now. If we keep
Hard to
these
tell in
people
the
on
future.
it, we'll be definitely next year at $100,000 again.
Yeah, we struggled with this question, so it is a very good and valid question because it is hard to predict. And I hope that we will be able to. I've gotten into the point though where, it used to be I always just, homeless people came and went, and the most I had them on was a couple weeks, we're able to find shelter. But the elderly and disabled is a new group of people that I've never seen at this level before, which has been hard. So, I've now been doing housing search for people who are struggling with an elderly person who doesn't know how to use a computer, doesn't know how to do applications, can't print out things. So it's hard to know, but if, I'm working on things with them and I'm hoping that something will come across, I don't know. It's hard to tell. But I think to what Paul is stating is true. We put, just because, we're having this crisis now, are we going to have this much of a crisis next year? It's hard to tell. And so it's one of those things that we budget too much and then we sort of hold on to money in an area we don't need. So it's really difficult to know exactly.
Okay, thanks.
It's easier for me and department heads to know that if Pat's gonna need extra money to pull back the reins during the year a little bit to help the town with that versus Pat has all this extra money and now it's on the tax rate and
Yep.
then it just falls to fund balance and it takes a couple years to get that money back to the taxpayers. So we've talked about this, and we have struggled. We meet every other Wednesday to talk about this stuff, and this is our number one comment topic that we talk about is where our projections are going to lie, and how, and even Pat's gone out, and not to beat the dead horse, but Pat's went out to the hotels and browbeat them to get the rates down even more than what they are.
We got some good contracts.
So
Well, we
did
get
some
better
good
contracts.
yeah, we got some better contracts than just somebody walking in off the street. So, we're trying every avenue as possible to get this, but actually, I don't know. I don't know if $57,000 is too much or too little, to be
No black
perfectly
and
honest
white
with you.
answer.
I don't have if I had a magic 8 ball, maybe I can shake it.
I'll sit in.
Thanks.
Barbara?
Yeah, so I don't know, Pat, if you're hearing this, but I heard this about one particular town, and I'm sure there are others out there, that they've actually cut back on some of their social service donations a lot. And that's why their tax rates are coming out so low, because they've really cut back. So if you're seeing an increase in the ask from these groups, that's probably why. I'm looking at the 83.99, and I would not be opposed to taking some of this and realigning it and putting it into housing. Because you know what? I don't think it's going to go away this year. I think it will continue. And in my mind, it's Maslow's hierarchy of needs. Food and shelter come first. And so I would say, it's very nice that we help support Big Brothers and Sisters. It's very nice that we help support Red Cross, because they do show up when we have fires and disasters in the area. I'm good with 1,000 there, but Big Brothers and Sisters, like on the Maslow hierarchy of needs, that's a low need. As well as, Nashua Mental Health Center. Yeah, of course, some groups always want a lot more money. I would take 7,000 out of them and again, put it over into housing, because that's where it's at.
Well, I'll tell
And
you.
any other, the other ones you feel you want to like,
Yeah.
maneuver or massage.
Well, I'll
But-
tell you, this is one of the reasons I think they put the social services in my budget, is because I really get a feel of what services really offset our costs for welfare. So this is why you don't see a lot of money given for Big Brothers and Sisters. Wonderful organization. I'm not going to say anything against it, but
They have a really good fundraising arm.
yeah. But I will tell you, Greater Nashua Mental Health, I don't know if I could have gotten through this year without them.
Is that right? Okay.
They have been so instrumental, especially on some of my homeless ones, because they are, having them go in, help them with housing applications, having them. I had one person move out of a hotel who had absolutely nothing. They got them, a bed, a TV. They know they were working with people, and if I didn't have these kind of social workers or people to help people that have mental health issues, it would probably stress me out even more. So I have to say, I can't say enough for some of the services that
Okay.
that we do fund, because I do think they are important, and you'll probably see you can see my priority, because I do look at the Maslow's hierarchy of need, and so therefore, as much as Opportunity Networks is a wonderful organization. Again, they did ask for an increase, but as you see, I didn't give them one, because I knew we had to really prioritize what I thought was really the most basic things that was most helpful to our end, to our residents, and also to what we have to spend to assist residents. So this is why, I have to tell you, Meals on Wheels, when I had an elderly client and a homeless person, no income, the son just kind of left her there, and we couldn't get her food. And I called Meals on Wheels, and they got her in there, and they got her food.
Good.
Because I couldn't give her a voucher to go to the store. because she had a disability. She couldn't get out of there. So, I mean, there was things like that, I look at some of these agencies and this is why they're there, and this is why I have prioritized certain ones. And when they're asking for increase, I understand. I have to tell you, they came and really asked for way more. I know they met with me and Paul, to try, and they explain their needs. Food costs have gone up an extraordinary amount. Fuel to get their volunteers to go from place to place has gone up an extraordinary amount. I understand all those factors, but as I explained to them, we just can't give a lot into these things. And, it would be good if he kind of, I know he's going to other places, but, we just can't fund it all. And so therefore I try very hard to look at those basic needs, put it into areas that I think, are most essential.
Right. I know we usually talk about this, you and I. But I noticed, you've kind of pared down the list, so.
She does do
Yeah,
a good job with
I
this.
try. I'm trying to balance it.
Yep.
I know, this is taxpayers' dollars. We can't fund and meet everyone's needs, but, and so it's a balancing act.
Well, I would just like to say for anybody who's listening, if you feel like you have some extra dollars and you want to make a donation to any of these organizations, they've met the PAT test. They're all good charities. They provide services to Merrimack and the surrounding southern New Hampshire. And if you're not sure what these organizations are, feel free to contact Pat.
And I just want to say one other thing. Just because they're asking for the money, Pat asked for their financial statements, and she asked for how many Merrimack residents do they help. And that's the key: is how many Merrimack residents, families do they help and help out. And that's one of the keys. And we try to get that information on all these organizations. And if for some reason they don't help a lot of Merrimack families, they don't get as much as what they might be requesting. So Pat does a yeoman's job of going through every one of these requests, and they start piling up September, October, and she starts looking at every one of them. So it isn't just willy-nilly throwing numbers down on a piece of paper. And while we use the words donations, we do not donate to them. We help them along to help Merrimack residents.
Right. We're funding a share to help make sure our residents have these services.
Any other question, Tom?
So I want to echo what Paul is saying, and I've sat through dozens of these budget discussions with you, Pat, and I used to really wonder why we're making these contributions or these payments and I am very confident in the work that you do to thresh out the good, the bad, the ugly from all of those requests, and I thank you for that effort. I think you do a tremendous job. You do a tremendous savings to this town, and I appreciate it, and just wanted you to know that. I was
Thank
struck
you.
also by the housing thing, but I think you guys have discussed all that to the extent that I'm satisfied we're doing the right kinds of things here. Keep our fingers crossed and know that we'll cover whatever we have to cover for state law. But I do appreciate the effort that you're putting into it, and you and your family put into the community. So thank you very much.
Thank you.
About Nancy?
I just had a question for Pat. Thank you. Pat, I was just thinking, when you have citizens that you're trying to find living arrangements for, I was thinking, especially in the terms of older citizens who may have health needs and healthcare providers local, when you're looking to place maybe out of this area, are you looking solely for residential placement, or do you find yourself having to take into consideration if the healthcare is all in Nashua and we're sending somebody to Littleton who is disabled?
Yeah.
Does that all get weighed in?
Well, I wish I could say that I had that luxury. The fact that when people are homeless, it puts them at a really high risk, and it's very stressful. So just health-wise itself is a devastating thing for people. And so the fact that if I found housing up in Littleton that's subsidized, that would shelter and give permanent things, I would have to consider that because of the fact that in itself, it's so stressful in itself to be homeless, to be living from day to day, not knowing where you're going to be, next week. It's just, and so with people who have healthcare issues and things like that, we do have to connect them to other organizations in the area and things like that. And that's where those social workers come in. Greater National Mental Health would have to then call up in that region to see where the mental health organization is up there to make sure they get connected with services and things like that. It's just that in the long run, we have to look at the priority of that being homeless is very stressful on the health too.
Great, thank you.
Okay, about the,
Nashua
I just
Transit.
have one question. Now, do you work with the state Medicaid with those individuals as well? Does that help
Anybody
them?
who comes in that needs services, like they don't have health insurance, they have to apply for whatever services that they need to. So I would take a look. In some cases, if someone's elderly, they would be getting Medicare.
Right. for
But
health.
they can be eligible for what they call the extra help. So therefore, or Quimby or Slimby, which is other things that help with the payment of those Medicare Part B plans. So there's different things that, yes, all these things would be part of my requirements that they apply for this, or in cases where people struggle with this is where those mental health workers,
Those are the
path
people, yeah.
workers for Social Security applications, all these things come in. And so, yes, we try to make sure they get everything that they could be eligible for.
So it's a much more complex kind of environment
Oh,
than
absolutely.
previously. Okay. Okay, and now transportation?
Yeah, if we want to turn to tab 1, line 01018405, Nashua Transit,
What's the number again?
01018405.
Thank you.
It's towards the bottom right before the elections. So in
8405.
8405. In late October, early November, Nashua Transit came to Pat and basically said that the hours for the town and the money that was budgeted for the town is going to run out in January-ish. And they projected what it would be going forward. And I said to them at the time we met in December, and I told them, that I said, I have a meeting with the council in doing my budget in January, and I'll have a better understanding of where the council may want to go with this program. This program is for elderly and disabled people to get to doctor's appointments, to get to work, to get to the grocery store to get groceries if they need be, and on the outskirts for elderly to get a haircut or personal grooming. We have found out that at the time we had several individuals that used the transportation to go to and from work. I want to say that this is a transit system. This isn't a taxi cab. This isn't an Uber. This is supposed to be rideshare, meaning several people at the same time. And Nashua Transit tries to get all these individuals going to Nashua. This is the time we're picking everybody up, and they'll bring them, and this is the time we bring them home. So when the budgets were being done, we thought $52,000, which is about $14,000 increase, give or take, would be suffice. We haven't had an increase in a number of years, so we figured $14,000 would suffice. And then Nashua Transit gave us the numbers that to keep us whole would be $73,000 for a budget number. So Pat has the information. We've done a lot of work. Once again, put it on Pat to do all this research and get the information and get the number of trips. And it was funny. They only wanted to talk to me, and they would only give me the information. I kept on saying, well, Pat, talk to them, get the information, look at the information. So they finally started to give Pat the information that we wanted once they found out that Pat was getting the information, and we talk about it. Right now, we are prioritizing elderly to go to and from hospital appointments. And the second thing is to and from work. And if individuals, because if they have to come to Merrimack and an offshoot, so to speak, not on their regular route, it's an hour and a half for them to get to Merrimack and back from Merrimack. So that eats up our hours for individual person. So what we try to do is try to book them at certain times where they would be coming to Merrimack and going to doctor's appointments and vice versa. So Pat has some numbers, and she has more information on this than I do, and to share with the council. But I just wanted to say that that $73,000 that's in the budget was a number that Nashua Transit said if we go forward, this is what the number would be for the town of Merrimack. And this started out as Nashua Transit came to us, the town of Merrimack, to help them get this program started. It wasn't something that Merrimack reached out to them, correct, Pat?
Correct. Yeah,
So-
this, just to give a little bit of history, back in the 1990s, the city of Nashua approached the town of Merrimack and the town of Hudson for a grant from the federal government. And so it was a match grant that, if we spend this amount, the federal government would kick in a certain amount, and it would provide transportation and a paratransit bus for, the elderly people. So it was something that we didn't have. Actually, even in our whole area, there was not any transportation like that anywhere. So we did. The town the select board agreed to it, and we started participating in the transportation program through the federal government grant. Over the years, the grant has gotten bigger, and they actually expanded it to disabled people. So it went elderly, disabled, and the primary purposes was to get people to doctor's appointments and necessary places that they needed to go. People do pay for this themselves, so to go from Merrimack, and it is restricted, it's only Merrimack to Nashua, or Merrimack within Merrimack. So if they go from Merrimack to Nashua, it's $4, and it's $4 to go back. So it's $8 if they go back and forth to Nashua to a doctor's appointment. If they go to a doctor's appointment within Merrimack, it's $2 each way. So this is the way it started. And so there's a box fare share, federal grant money, and then our portion that we subsidize with it. So over the years, we've been working with Nashua on this. 2 years ago, well, actually just a year ago during the budget process, they're not used to our town council budget starting so early. So, and we kind of forgot to ask them. And what happened was on February 28th, they submitted their budget to us. And it went from 38,000 to 52. And they cited, wage drivers increases, fuel increases, mechanical issue, all these things. So we were like, it's just too late for our budget cycle this time. So we were stuck with 38,000 that was in the budget. And so therefore we had to negotiate a contract with less hours. So here comes the perfect storm now. All right, we go into a new fiscal year with less hours. And we are coming off the pandemic, and people are starting to ride again and go to doctor's appointments. And now some of the disabled are getting out there, and they were trying to need a ride to go to work because they can't drive. So this is what happened. So what happened is the end of September, they told us our money wasn't going to make it beyond January because of the number increase in riders, their increase in costs, and the hours that were reduced because of the lesser amount of the contract money. So this is where we are now. So we're looking at, what appears to be a $34,000 increase, but in actuality, it's almost like a 2-year increase because we missed the increase last year, which would have been 19,341 they would have asked for last year. And so therefore it would have only been a much smaller increase for this year. And this is where we stand though today, is that we were looking at, Paul had to make this tough decision. What do we do now? Because we have people who have come to depend on the paratransit rides. And, I don't know about you, but I know I went to a doctor's appointment myself in December and I saw the bus pull off and there comes an elderly lady coming off. And I thought, oh, it's nice to see someone, that it's really, benefiting. I could see, it is something. In the years that have passed, it's now Southegan Valley has now paratransit bus service, but they actually have a group that raises money to, as well as going to all the municipal governments, and they jointly collect money for their bus services. And so this is where it's evolved over the years. I've sort of gotten involved in it because originally I was I was asked to be on the committee for community transportation back in the early 2000s because, we always know this was going to be expansion, especially with the fact that our population is aging. We know this is going to be something that's coming down the road. We're going to have more need for this than not. So this is where we are today. So if anybody has any specific questions after I've just kind of given you all that information, please
Are
let
they
me know.
still getting federal grants?
Yes. Yeah, I'm not too sure. And I don't want to say what funding it's from because I'll probably be wrong.
What
I'm not a
department?
transportation expert, so I have to, say that and disqualify myself. But it's something like 50-something, 03, something like that. I don't know.
We
Exactly.
also asked to raise the fare box and what that would look like. And by raising the fare box, even $2 or $3 one way, it didn't bring the cost down significantly for that. They're paying $8 to go round trip to Nashua. Even if we brought it up to $10, it would still be $68,000. So we'd save maybe $5,000 on that. So it wasn't. Pat has that information.
We have 308 people registered for riding right now. So it varies, because not everybody needs a doctor's appointment every week. However, that's why the people who were disabled, who were going to work every day, really increased the hours. We went from having one person last year to now having 3, and that's what did it to us.
Is 3 different times or 3 at one time?
3 people, just 3 people.
At one time or 3 different times?
No, they get picked up at
going
one time in the
to,
morning,
It's
and-
one, but
I thought what they told us is that pick up in the morning.
right.
I thought it was 4 in the morning because one gets dropped off here in Merrimack and then the others go to Nashua. And then coming home, it's 3.
Yeah, well, I'm not too sure, but it is the biggest. The biggest problem is it's 5 days a week, and that was what was driving up our hours was the fact that people were, 'cause if
Beyond
they-
the appointment.
right. I mean, when we're dealing with the elderly and disabled who are using it for medical or grocery store, it's not every day.
Intermittent, yeah.
So 308 people, it's dispersed out. But when you have a disabled worker who needs to go to work, it's 5 days a week and it's 2, back and
Are
forth.
they all disabled? The ones that are using it for work?
Yes. Yes. Otherwise, they wouldn't qualify under this bus service, right?
And we've changed the priority with Nashua Transit now. So the priority is once again elderly, hospital.
Yeah, we did ask them to hold off in any more applications for any new riders for work people because those are the ones that really eat up our hours. The other thing we had to do, and this was not very popular to the parents of the disabled person, was there was one person who they were coming into Merrimack in the afternoon just to pick them up because they got out of work at like 2:30, and the bus that would bring home most people didn't come back until 3:30. So they were, it was like an extra hour and a half that they were bringing this one bus in just for one person. So we had to ask them to ask the person to go on the 3:30 bus. We thought there was going to be problems with the workplace, but the workplace was fine with it. So yeah, so we tried to accommodate the people that are already taking the service. It's just that, you know, at this point, we just can't afford to take any more on at this point.
Any questions?
No, I think I agree with you. I have a hard time believing that we need to be providing a taxi service for work. I realize people are disabled, but even able-bodied people take taxis or drive their own cars. I mean, work is one thing. Going to a doctor or something like that, if you're incapacitated or something, is a completely different thing. And if it's a constant 5 days a week thing for work, I feel like they ought to be able to hire a taxi or something like that if necessary. Getting a town-funded Uber service just doesn't make any sense to me. And so I agree with what's been done with limiting future applications and maybe trying to push back on some of the others if those are the ones chewing up our hours.
And I even asked, and we didn't get the information from Nashua Transit. I asked to say, okay, would ask the riders and the parent, because the parents are there in the morning, ask them that if we go to a bus stop system, so to mean that the stop is Town Hall and the pickup is at 8 o'clock, how would that affect it? And we haven't heard back from them on that information, but we're trying to think outside the box. You know, outlet mall, Town Hall, someplace where it's centralized, where they all have to be, and then they go get dropped off and they get picked up and dropped back off to a central location. So the bus isn't driving out to Babuzik Lake to, you know,
So if
Back
you've
River
got-
Road.
So if you've got 4 individuals going down at one time, they have to pick up 4 individuals at 4 different places. And then on the other end, when you're dropping them off on the way home, you have to drop them off at 4 different places.
Right.
Yeah.
It's
And
called,
that is an Uber.
well, because it's paratransit, you know, it is curb to curb, they call it.
Okay,
Curb to curb service. So, yeah, because
gotcha.
of the fact, but the problem
But
is
that
too
adds on
is
time.
that does, if that person doesn't have the transportation to get to a central location, it's the same, we're back to the same problem too. But it's also too that many of these people are just disabled, meaning they have mobility issues or cognitive issues, which, you know, make it limiting for them. So that's why it is a curb to curb service. You know, people don't go in and they have to be able to get out of the house themselves. But it is something that they go to directly to where they live and back.
And 2 of the individuals live in the same neighborhood.
I'm sorry, what?
2 of the same individuals that take this to work live in the same neighborhood, and that's one of the reasons why they brought the 2 on, is because they live in the same
Because they're
neighborhood.
picking up 2 instead of 1.
Yeah, 2 instead of 1. So
Nancy?
Thank you. I just have a question. I understand, I mean, the cost, and I'm a parent of a adult disabled child. But where do how to make a decision as to how we draw the line as to, do we run into discrimination questions? Because, you know, what if I'm all of a sudden need this service and the rule is, yesterday was changed that my next door neighbor can do it, but I can't do it. I just wondered, does that put the town in a difficult place? Or, I mean, I know where do we get the money, but how does that work? Because I can see that with an adult disabled person who doesn't have a license, who can't do whatever, and an elderly person, both have similar needs, different probably, but how do we weigh So I don't know how you do that. I
Well,
don't
and,
envy you in your
and
job.
quite honestly, I don't do it. I don't do it. The thing is, we've always funded it, and Nashua Transit does all the hard decisions like that. But mostly, the thing is, like, I think the by setting the priorities of where they go, it's not really setting and excluding someone like a disabled person could go to their doctor's appointment. It's just that the issue of the ride to work is the part that is what we're limiting at this time. We didn't want to take services away from people who already have them, but the problem is that's where the cost was adding up. So I guess we were looking at it as we didn't want to eliminate this service for all the other people. If we kept this going, then we would run out of money and no one would get any service. So it was a matter of limiting their destination as opposed to limiting the person.
Yeah. Another question. I wonder, does Voc Rehab play any part? I mean, I just wonder if the goal is to have people working, and for many benefits, there's a requirement. You want to have Medicaid, you have to work, or is there either through a budget through developmental disabilities or Voc Rehab to support
Good idea.
working? I wondered if that's I don't know if they offer that, but I just wonder if.
Yeah, we don't have anybody on Voc Rehab, but I know what you're talking about. But they do have budget for Voc Rehab if they have transportation things of that nature. So it is in their budget because that's a DHS program, DHS. And what we're more seeing is people who I think were doing programs through disabled programs where to give them opportunities to be functionally in a normal type environment to try to give them, a normal way of life, the way we'd all want to be. And I think this is more I think people that are using the transportation for that reason. It's not for Voc Rehab or welfare to work program. So there's different sources. However, I think in some cases too, and this was another issue, is we think there was transportation in some of these programs that was providing people transportation, and they were struggling with funding. And so this was a source of saying, oh, well, why don't you take the paratransit? You live in Merrimack, they have paratransit there. So, I know there was, with one case, a situation was this person, getting transportation by that program and then being told to go do the paratransit. So I'm not sure. That was something that was brought up to me by Nashua Transit, but we never really got an answer from that because I called the agency to ask them specifically when they told me that, and they said they did not. So I don't know.
We haven't sent anybody your way.
Yeah, that's what they said to me. So I
Hands
was
up.
like, okay, all right.
So-
I just don't know. Sometimes this is the thing, is everybody's pointing fingers,
Sure. So are you referring to area agency down in Nashua?
No,
Or,
no.
I mean, because
Yeah.
they have funding for people that,
Right.
that
They
can
have
give them
state,
rides and
they're a
stuff like
state
that.
program, so they should be able to get state funding on their transportation. But no, these are nonprofit organizations that do train individuals and then, try to give them,
But they work with area agency in a lot of their
They
things.
might,
from my
but
familiarity,
then I guess, and see, I don't know all the ins and outs, so I don't want to say something that is inaccurate, but I heard that at some point, then they get moved into the mainstream of the population without that funding. So I don't know exactly, like I said, I don't know enough about those agencies and how they work and how those things go. But, you know, I just, you know, I was told by Nashua Transit that an agency was, you know, had been transporting this person and then stopped and was told to apply. So, but then when I asked that agency, they said no.
Well, that's interesting because I'm familiar with an agency that falls into that descriptive category. And
Yeah, yeah. And I don't want to say it because
yeah, no, I
don't-
understand that.
I
I'm not trying to do
yeah,
anything
because I
there,
think,
but
you
either.
know, it's like, this is information that I can't, you know, collaborate. So I don't want to say that.
But the big discussion on hand is the doubling almost of the transit
Right.
because of what really is the cost that is going to be associated with providing this service
And
to them.
my question, it was initially for disabled, for appointments, blah, 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 elderly.
For elderly. Yeah.
Elderly. Now, so Nashua, the transportation company, decided that these people related to work came under that umbrella, and therefore they've started to use them?
Well, initially, this is the whole thing too. See, the pandemic did a whole thing here too, because you have to remember when everything stopped, even people stopped going
Everything
to their
did.
appointments, people stopped going to work, people stopped participating in certain programs. So there was a lull for a long time. And this is the other problem is like, and then all of a sudden, you know, now people are going back. And so
But
we
they're
don't know
But
when
they're
that gap.
restarting under different criteria than what we understood.
No, the disabled part came in. I have asked Nashua Transit when they moved from elderly to the disabled elderly, and they said it was more funding in that. So it would definitely, it was better funding source for our, us in general. It provided more funding for us than the just the elderly service part. There was more funding in the disabled section.
But the appointments rather than work component.
It started that way, yes. And then what happened was when, like I said, we had this money and then people started going back, it was like, all right, this person wanted to use it for work, you know,
And they went, okay.
and they went, okay, because they had the hours, we had the money, you know, and we have one
So it was
person
their
who's been
decision,
taking
we
it
had
for
to
3
live with it.
years now. And now, you know, so this is the problem. It's back. Now we have, it's been increasing and increasing. And so now we have, again, the perfect storm of 3 or 4 years of unusual situation.
Gradually increasing.
And then and what happened that we got more people that maybe became elderly in those 3 or 4 years. And so it's
that's
hard
why
to tell.
we prioritize with them again. This program is for elderly to go to appointments
Well, that's my point.
and then
And disabled to
and
go to the
disabled.
appointment.
The elderly and disabled to go to doctor's appointment. Medical
Well,
is
that's what I'm
number
saying.
one
They changed
priority.
That criteria was changed without us knowing it. And the impact was a dramatic increase in the number of hours because of that changed criteria. Still elderly and disabled, but it's not
Yeah.
appointments, it's work.
Well, I have to tell you, they did call me one time and ask me about a person, and I said to them, well, I said it's up to you and whether you think you have the ability to get those rides in, but can we discriminate against that person for
Gotcha.
their need to? I don't know. So, you know, it's not like they just did it willy-nilly
Yeah,
too.
okay.
I think, you know, I think we were all trying to do the right thing.
Yeah.
But in the end, now we have to start prioritizing because of the cost of everything.
Barbara, you had a question?
I went looking to see if there were any regulations that state that we have to provide this service, and I couldn't find any. Do you know of any?
There isn't.
Okay. And do you know if the drivers assist the person to get on the van, or do they have to be totally able to do that themselves?
They assist them only like to lower the ramp so they can get their wheelchair on.
Yeah, whatever's in the van.
Or, you know, they might help them take their walker and things like that. It's only at the curb, though, that they can
Yeah,
help them.
they don't really touch the person to help them step up or something like that.
Right.
Because, you know, For $78,000 a year, and if we counted 2 years, we could provide that service ourselves. We could buy a van. You can buy a wheelchair van for like used $40,000, and that's a souped up one, and hire someone to do it. We wouldn't have to worry about the hours, and we could still have a cost share. Just, I'm sure Primex would have a heart attack. But I mean, really, if you look at
The cost.
it, we could almost do it ourselves.
Well, I have to tell you, we looked
No,
at this.
Paul's going to have a heart attack.
Yeah, we
Yeah,
looked
Paul's
at
gonna have
this
a heart attack.
back in I think the early 2000s when and whether it would be cost effective, but then we quickly realized salaries, benefits, maintenance, liability insurance, fuel, all these things added up. We were getting a bargain. We realized, when we started looking at all these things, that it really wasn't. The other thing is software to keep track of everybody. They have, applications come in. We'd have to hire, because I'm not doing it.
Can't say I blame you,
She's drawn a
Pat.
line in the
We-
sand.
Can't
We'd
believe
have to hire Pat full-time and give her another full-time person to take this
Yeah.
program on.
So when you start looking at all these extra costs,
It
it
was just a
really is
thought.
extra costs.
No.
Yeah.
We've looked at that as well. We have looked at those things as well.
Yeah, I was just going to say, I'm sort of playing devil's advocate in my head. I think the people that partake of this are also taxpayers. I think that, the welfare department does what they can to support people with needs that maybe not everybody has. I get that it would be a burden, but I think it's something that we should look at down the road because we're accepting funding sources because there's more money to transport disabled people. So we take the money, but then in a way we're saying, well, you can only use, the disabled people can only use it for, I'm not saying it's right or wrong. I'm just saying, if we're taking the funds and then limiting access just because we don't have the money, I get that. But I feel like it's something that we really should look at because, I know a lot of disabled people in this community and, there's a quality of life that I think we should be caring about I'm not saying we don't. But to put it all in perspective, because it is such a huge expense and we are reliant on, a provider that's assisting us. I don't know, this is part of the thing, I guess, with not living in the city with no bus transportation and if you're on disability or you're a senior citizen, your income's pretty low. And if these people don't have the support of family and friends, how do they get anywhere? So my heart's a little torn on this one. And I don't know, I would just like to see us look at it a little bit more and, I'm not saying now, I don't have a heart attack, but just something to really figure out, is there a way that we can better meet people's needs without breaking the bank? Not having our funding sources tell us how we can meet the needs of citizens here. So I won't say anything else. Thanks.
To be reexamined.
So
What
can I
happens
add-
in the meantime, though?
Can I add a little bit to that? You talked about taking funding for disabilities. Nashua Transit is accepting grants
Yeah.
to work with disabilities, not
They get the
Merrimack.
grants.
We're being charged a percentage to participate in the program, and the percentage they're charging is by the number of hours they're going to provide driving in and out of Merrimack. So we're not taking money from disabilities or anything like that. I just didn't want to have the misperception out there that we're out sucking money from the government.
Oh, no.
No.
Merrimack's not getting
right.
it. Nashua
don't get
Transit
any.
Right.
is.
But what I'm
and-
saying is the entity that we're relying upon is taking that funding, but we're sort of now, because of the hours and the numbers, it's putting us in a position, even though that funding is available, we're having to make a choice. Maybe they're making the choice, but do we transport elderly? Do we transport disabled? And where's that line get drawn? So I agree, but you're right, Tom.
Okay, thank you.
Okay, I think we've beaten that to death. Okay. On the whole kit and caboodle. Well, does anybody want to? Personally, I don't think we have I think that it's circumstances that I personally don't feel we can do anything about because we're in a catch-up mode but I am receptive to a more critical examination in the future, knowing that, one, it's not required, two, morally, maybe we are. I mean, that's part of the discussion too. But I think we're and
And I think because we put the moratorium on it, that we're not going to get
Any
more
more.
people going to and from work. It's really the priority.
right,
So we'll have to look at it in the future.
Barbara?
Yeah, just looking a little bit in the past, because you were saying, Pat, that during the years of COVID, when we didn't have any ridership, we still gave them money. Where's our money?
Well, that's why we didn't have any increases, and that's why they didn't increase our requirements for what, 3 years. So we got used to having only paying the 38,000 for about 3 years because they never increased it.
So it's like we had an account and they were just spending out of the account for whatever we gave them.
Yeah, but things, people were still using it. I have to say, I was surprised. But I mean, when you have to go to a doctor's appointment, you have to
Yeah.
go to a doctor's appointment. So,
Exactly.
it was just that people were wary and not, I think, using it as much. But now, they're getting back to it.
And I think even before that was 2020. I think even during COVID, it was like $27,000 or 32. I think it went from 27 to 32. So that's what it was. It was 27 when it first started. When I first started, went up to 32 and then to 38. So it's been at 38 since
The last,
in the budget books 2000.
yeah.
What's the pleasure of the council? Anything?
Relative to this line item,
Either the welfare or this line item, either one.
I'm okay with welfare the way it is. The 73,000 is the funding they require for the upcoming budget year, based on their current services.
Correct.
Okay. So unless we go tell people they can't use it anymore, we have to pay the 73,000. Well, I mean, it would cut the hours if we drop that, right? I don't know how to do that.
No. And that's why I think it's worth examination in the future. But,
As we keep going forward.
right. Barbara?
Barbara?
One more question, Pat, and for the towns that do not offer this, can a person still contract independently with Nashua Transit for the service?
Yes, and actually, South
And they're
Hagen
paying out
Valley.
of pocket.
South Hagen Valley works with Nashua Transit too, but South Hagen Valley they actually hired a person and they booked their own appointments and they managed their applications and everything like that. So therefore, it's a little different where Nashua Transit does the whole thing for us.
Mhm.
So we kind of got grandfathered into all that administrative stuff that they would have had to pay for. So, but I think the whole South Hagen Valley does, they do purchase or work with Nashua Transit for the funding because they do get some federal match too. And again, don't ask me where it comes from as far as the federal grant money, but I do know that they contract with Nashua Transit too.
But not individuals.
No, it's done as a collaborative. So it's like, Milford, Amherst. I know Wilton wants to do it. It wants to get out that far, but all those South Hagen Valley does it. The only municipality that does it like us is Hudson. Hudson, because we had the most population at the time. That's why Nashua approached Merrimack and Hudson. So we got to get into it with the ground level and get all the administrative stuff done too.
But if you're a private citizen and you're not in Hudson, Merrimack, or that
Yeah,
South Hagen
no,
Valley,
no,
you can't
I'm
call them
sorry
up and say,
if that was your
I need a
question,
bus.
no, they can't do it individually. You're right. I'm sorry.
Okay. Okay, can I assume by this quietness, we're gonna leave it as is? Okay, but I do think it's a future agenda item, it's worth examining
yes.
critically.
very much so. And we're going to stay on top of this for the next 6 months of this fiscal year and actually probably get back to them sometime in March and sit down again to see where we are at.
Right, we've already asked for new numbers and where we're at. We're gonna just have to watch it.
And I just want to acknowledge your hard work too. I think we all know what you've been going through.
Thank
We've
you
been
very much.
communicated with. And so we're just saying, take care of Pat, take care of Pat. So I want to thank you for the hard work and, you know, you work hard anyway. This has just been a more strenuous year for you, so
Thank you, yes,
thank you.
I appreciate it.
No, I agree that you probably have one of the more difficult jobs in town because not that everybody doesn't work hard, but you have people sitting in front of you or standing in front of you waiting for an answer, and it can't be easy to tell them no some days. So,
Yeah.
it's a very difficult job.
Thank you, Pat.
Thank you.
Okay, library people. It's
Hour and 10, we're not getting back.
I'm sorry? I know. And that's tab 15. We're not going to take an hour and a half of it.
Yvette would be happy to talk about the library for an hour and a half. No, sorry, Yvette, only in a great way. Good evening. I'm Deb Koval. I'm the chair of the Library Board of Trustees, and I'm here with Yvette Kauser, our library director. And we also have Janet Krupp, our treasurer, and Jen Jobin, our secretary, with us. So thank you for this opportunity to present our budget. There aren't a lot of things I have to say, but of course, we'll take any questions you have. I will just note, of course, like everybody, we have the increase in our health insurance. We also, as we've mentioned over the past few times we've seen you, been working on making our staff salaries more competitive. So that has been something that's been a focus for us. And the trustees decided this year from our anticipated funds, our trust funds, that we're contributing $17,200. That would be, you'll see it in the bottom line. There's the town appropriation, then the $17,200 from the trustees, which is an increase of $5,200 from what we did last year. So to offset some of that, we took some extra money from our funds this year. So that's really the highlights. I'm happy to answer any questions, or I don't know if you have anything to add to that, Yvette.
No, that was great, Deb.
Yeah, it's pretty self-explanatory, actually. It's that. You have to understand that usually the discussions are longer when there are problems. If the discussions are short, take that as a compliment. Or that you're lucky that there are no problems. Any questions? Pretty self-explanatory, actually. And you're right, the health insurance, but it's every department. so.
Right, yeah.
Any questions? Oh my God, we go from one extreme to the other. Seeing none.
Okay,
Okay.
great. Well, thank you. Have a wonderful evening. Thanks.
I feel like I want to
See
give you
all.
more attention. I was gonna
Aren't you
say.
glad? Aren't you glad you waited that long for all of that?
Next, Parks and Rec, tab 13.
So
Good
Ma-
evening, Matt.
Matt's here to present the Parks and Rec budget. Before Matt starts talking a little bit, I just want to put the focus on 0113 8505 infrastructure, Wasserman Park Beach Phase 4. We had, Matt and I both had discussions with Don Tuomo about this. Don did a permit when we first did the other phase of the Perch Beach, and we thought the permit was running out in fiscal year ending in June of 25. We found out it is running out in calendar year 25, November of 25. So we have a little bit more time on this, and then Don did some more research today, and actually we can ask for a one-time extension of this. So next week I'll be making the recommendation that we hold off. Told Dawn this summer to have the summer interns work on better pricing than a guesstimate of $100,000 in this budget line item. So we'll be backing out the $100,000 in this line item. But just know that it will be in the 25-26 budget with a hard number to do the handicap access to Wasserman Park Beach area. And that's really what this phase 4 was to add a ramp for
Access,
handicap
ADA.
access to the beach, ADA access. So that's why, but we feel that we'll be able to push it out into the 25-26 year.
You're not suggesting the 100,000 was for a ramp.
No, but there was other work that needed to be done, leveling it out. It was no work in the water. It was all on land, but there's some tree roots, things of that sort that would have to be and get down to the waterfront access. So that's why we're taking a step back, letting the interns this year work on actually getting a costing of what it would be and a bid spec ready so that we can go out to bid and be able to hit the ground running. So that will be being one of my suggestions coming next Thursday or Wednesday.
Okay.
Matt, you can take it from here.
Now that you've just had 100,000 slashed,
Yeah.
you feel okay.
It's good, and hopefully mine will go almost as quick as the libraries just did. So because my
Let's hope.
budget gets a lot simpler when you take that out, because realistically we've level funded
Yeah.
pretty much. So good evening, everybody. So Parks and Recreation, for those that are at home, exists for quality of life. And we do this by providing a wide variety of recreational programs, special events, and services in safe, well-maintained facilities. This year marks year 11 for me, which is a little crazy. Sometimes I go, how the heck did I get to year 11 already? But anyway, I want to, before I get into the budget, I want to just kind of highlight a couple of things. I want to highlight, first of all, our summer camp, which has gotten better out every year. And over the last 3 years, we keep breaking our own enrollment records. Our summer camp has been continuously accredited by the American Camp Association since 1994. And this past summer had our 5-year accreditation visit, and we passed with a perfect score. So it was nice to get that done and out of the way for another 5 years. When I came to Merrimack in 2014, that first summer, we had 750 total registrations for the entire summer. Last week, we opened up registration for this year, and in a single day, we had 893 registrations on day one. Last year we finished with just over 1,300 campers, so almost double in size in 10 years. And so obviously our goal is to pass that 1,300 this year, and we're already at about 78% of that number a week into registration. So off to a great start there. And then, as you know, we started our new after-school program this fall. Initially, we were serving just Thornton's Ferry School just due to the cost of bus transportation. But in November, we were actually able to expand over to cover Mastrocola because the bus was able to get to both schools in time, so we didn't have to have two different buses. So we are now serving both schools. And that program is continuing to grow. Eventually, we hope to get to Reed's Ferry too, but that would definitely have to be another bus, and we haven't quite figured that one out yet. But couple again quick just successes before we get into the budget. And as Paul alluded to, with the removal of the beach project for this year, my budget gets a whole lot simpler. For the benefit of those who are at home, our budget is broken into kind of two factors. First, we have our the taxpayer side of the budget, which for us realistically is a lot of things we don't have control over. It's health insurance, it's electricity, it's natural gas, those types of things. And most of the things within that we do have control over are very minor increases or are level funded for this year. There are kind of two sections that I do want to just highlight. And the first one starts with 01138107, which is in our part-time wages. This line item is actually going down by about $400 compared to current fiscal year. But what we're doing is kind of shifting some money around a little bit to try and do a couple of different things. Currently we have we staff the beach on weekends with park attendants, one that's kind of up in that resident parking lot, the other one that's down kind of at the waterfront, because we have multiple access points to the beach. And part of it is, you know, if you remember when we were having all those issues, particularly back in 2020, you know, part of the advice we got from the police is in order to ask somebody if they were a resident, we had to ask every single person. And there was just no way to do that with a single person. To just too much ground to cover. So we've had 2 people in that role for the last several years. But what we're trying to do this year is actually get back to weekend lifeguard coverage, which we haven't had in town in at least 15 years and maybe longer. We had gotten funding for it back in, I think, going into 2020, and then we know what happened that year. And then it's taken us a couple of years to, you know, we kind of lost 90% of the staff didn't return in 21. And so we've been slowly rebuilding, and we think we're back to a point where we can try to staff that again. And, you know, we've had what we're basically doing is swapping out one park attendant with one lifeguard. There was always 2 lifeguard positions in the budget, and we're just flip-flopping a lifeguard for a park attendant. They obviously make us a little bit more money, but obviously having lifeguards in place makes the beach a safer place, less issues with vandalism and trash and those kinds of things. One of the things we've also been talking about is, and we've gotten a lot of requests the last few years about, you know, we own canoes and kayaks and things. Could we rent those out to residents as a service? And so we're looking at that, but I want a lifeguard to manage that, then making sure that they're wearing lifeguards and they're on, or life jackets, and they're on properly and those kinds of things. Not that I couldn't do it with a park attendant, but I'd feel more comfortable, certainly. So that's one piece. Secondly, you know, we have had in our budget for several years now a part-time year-round maintainer position, which was 25 hours a week. And this person, you know, we have 19 buildings at Wasserman Park that they're basically responsible for maintaining. The person that had been in that role for the last 4 years left us. He officially retired in February of last year. We basically had no maintenance staff through all of last spring. We got some summer help through the summer, and then had nobody up until about 2 weeks ago. You know, one of the things we found was that, so, you know, realistically, this has to be kind of a Monday through Friday position, because, like, if I need them to do work with power tools, they can't be by themselves at night or on a weekend just for safety issues. And so, you know, we're looking at somebody that's kind of semi-retired, you know. And what we found is that somebody that's semi-retired doesn't necessarily want to work 25 hours a week, which is why it took us 10 months to officially fill the position again, you know. And so what we've done here is we've reduced the hours on that maintenance position from 25 hours a week year round down to 15. But then what I've added in is hours for the summer maintenance help to help this person. You know, 15 is enough to kind of deal with the maintenance issues during the school year, during the fall, winter, and spring. Summer's when we're kind of rocking and rolling with, you know, weeds and, you know, mowing lawns and, you know, whatnot. And so those are kind of the changes within this line item. Like I said, the net result is a savings actually of about $400 compared to current fiscal year. But it's changed, so I wanted to bring it up and highlight it. The other one that I just really wanted to highlight is going down towards the bottom to 01138374, which is labeled recreation programs. And this line item is really the special events that we run. So this is Halloween, holiday parade and tree lighting, the winter carnival, Easter, the summer concert series, and our movies in the park. And the movies we've been doing for 7 years now, partially with funding from the town and partially with sponsors from local community organizations like the Lions. and, you know, early on we were getting, you know, 150, 200 people at each movie that we were doing. And we were doing, some years we were doing 4 or 5 movies in a summer, and it was doing really well. And I think the novelty is kind of worn off. This past year, we averaged 45 people. So we had one movie with 25, one with 45, and one with 65. And it just kind of felt like a waste of time and energy and money, frankly, for the effort, you know. With that said, what we're looking is simply shift the money that we had from the town on movies over to our concert line item. We haven't raised the amount we're spending on summer concerts in 7-8 years, I think now. And, you know, it used to be that, you know, we'd have a mix of like $400, $500, $600, $700 bands. Well, it's more, bands cost a lot more now. And while you can find some in that price range, most of them are $1,000 or $1,200. And, you know, we find that, you know, on a night when we have a band that's $1,000 band, a, you know, higher quality band, you know, we'll see 250 or 300 people versus a night when we've got a $500 band, we're seeing 70, you know. And so, like I said, we're shifting the money over this way so that we can, you know, get better quality. You know, this is a lot of our other events, Halloween and Winter Carnival things are families, but really more kid focused. This is certainly something that's more adult focused. And like I said, we draw a large crowd on Wednesday nights. We are planning on 10 concerts this year, which counts the July 3rd concert just because July 3rd falls on a Wednesday this year. You know, and so that was really the main things that I wanted to highlight on the budget, on the taxpayer side of the budget, but open things up to questions before we talk about the revolving fund.
Any questions? Barbara?
Just a couple, Matt.
Yeah.
For the MYA.
Yeah.
The dollar number has gone up. And yet those programs are also subsidized by fees and whatnot. So do you have any information on why they're asking for more money?
They asked for $1,000 more, and I didn't really see the need to cut it for $1,000. They're it's the cost of doing business, insurance, audits
Okay.
that have gone up.
Yeah, we
for
do
this stuff.
require them
And
to do
our
an audit, which is really expensive.
Yeah.
Yes, it is very
Unbelievable.
expensive for
Yeah.
them. But we require it.
That's right,
And they
they
do
do.
do it, and they have been doing a great job of getting the information
Yeah, it's dramatically different.
different than what it was before. So for $1,000, I didn't
Okay.
see a need because of inflationary cost of doing business.
And we have a community band?
Yes. Yeah, the Merrimack Concert Association. So it's a
Yeah.
band and a
Did I
chorus.
like miss them all these years?
They play on July 3rd for us.
Okay.
And then they do a concert in December and then another one in May, I think it is.
Yes.
How about that?
Yeah, and the payment that we give them is really for the concert. We'd have to pay, you know,
Yeah.
instead of paying for the concert, we pay for that. And they store all their equipment with the library, so.
Oh.
Or at John O'Leary, one of the two.
John O'Leary. I
John
believe.
O'Leary, no.
Okay, that's all I have.
Anybody else?
No, I think, as always, the Parks and Rec
Yeah, they
adds
do.
to the quality of life in Merrimack, and you've been doing a great job of keeping the funding as flat as you can and providing tons of services compared to what we had 30 years ago.
Yeah. Well, and if you think about it, again, 11 years ago, we were doing 20 programs a year. This past year, we did 320. And actually, we were at about 300 when COVID hit, and it wiped out 90% of them. And so we've spent the last 3 years kind of building back up to, like I said, we're at 320 now. So, and continuing to
I
grow.
agree. I just have a curiosity question here.
Yeah.
On 8244 water, it's doubled. Is that because we're irrigating more fields or something?
Yeah, it's the increase in rates.
Right.
It's also irrigation for the fields.
So it's just more of it, more area.
More
Okay.
irrigation.
Okay.
Which one was that?
8244.
Yeah.
244.
You went from 11,000 to 22.
222, doubled, huh?
Right.
Or is-
Although the year before,
was 21.
was 21.
Or
so
22, yeah.
do we have a dry, we had a moist year. We had a summer that we didn't
Well,
have to
for some
irrigate
reason,
as
we just
much.
didn't budget it this past year.
Yeah.
We cut it in half almost.
It's weird. And the other thing is 8510. The capital reserve fund for the field.
We will be talking about that when we go over capital reserve
Okay,
funds.
that's fine. I think, okay, that's fine. That's great. You got off, go ahead, Barbara.
Oh, and this isn't a
Well, that's
question.
just
This
your
is,
part.
this is
That's
just a
just the
nice,
Tax
so
part.
I have friends who used to live in Merrimack and moved to Hooksett.
Yeah.
Right? And they still get, on Facebook, they can still go.
Yeah.
They're jealous. Because I guess Hooksett doesn't do as much as you do. So,
I'm not sure Hooksett actually has a department anymore.
Yeah.
They used to run a summer camp program and it wasn't well run, and they basically, the town kicked out the town camp and gave it to the Y to run, and the Y runs their summer camp now. So
but people do notice what's going on for Parks and Rec
we
in
do what we
Merrimack,
can.
and we appreciate it.
Okay, you can go ahead.
all right, so
Continue.
so the revolving fund, again, this is just kind of a refresher again, mostly for those watching at home. Revolving fund was established 8 years ago by town meeting, and it was done so that all the programs that we are run are entirely self-supporting. We don't get any taxpayer dollars to run those programs. But we talk about it here at this meeting tonight just for kind of transparency purposes, so people can see a little bit about what we're up to. Prior to having that revolving fund in place, every time we wanted to create a new program, I'd have to, 18 months in advance go, okay, I want to start a new, and one of the ones we started back then was the teen camp that we now run. 18 months from now, what's it going to cost us to run it? What are the salaries going to be? What's transportation costs going to be? And it was purely guesstimate. And then it was hoping that you guys would approve that. And then when we took in revenues for those new programs we created, we basically give all the money back to the taxpayers. The challenge with that is, one is trying to forecast 18 months in advance. What's going to be a trend? What are things going to cost, with programs and services? And which is why we were only running 20 programs a year back then. And as I said, this past year, we ran 320 different programs. So all the programs that we run, on top of the direct costs associated with those programs, salary, supplies, whatnot, we are tasked with covering what's called a salary allocation for town administrative costs. It's a little bit of my time, it's HR's time, it's payroll, it's purchasing, so forth. And so each year in preparing the budget, finance department says, okay, this year that salary allocation is X. So this year that number is $60,020. And so in our revolving fund, we have to build in the cost of that $60,000 into all those 320 programs. And the way we used to do this was we would take kind of our 6 or 7 largest programs, which was camp was a big portion of that, and charge it off to those big programs. And I've done it a little bit differently this year, just because like camp was paying, I think, 92% of that $60,000, and so trying to spread out that cost a little bit to everything else that we've done, because we have grown into offering more. So if you go down through the sheets, we'll start with the day camp line item, which is the first page of the revolving fund. And so for each of the programs, if you look down at near the bottom of the day camp section, day camp budget, you'll see director salary allocation. And like I said, this is that for Camp Natticook and Trek, it's $39,560.
Hold on a second. Paul, did you want to say something?
Yes, thank you.
He was
Madam
trying to
Chair.
get my attention. I'm sorry for interrupting.
Right. Just know that he breaks it out evenly throughout the programs. He because we have Trek, we have summer day camp, we have the after school program. So what he does is he takes the $62,000 and runs it that way. The only question that I think really the council really has right now is, what is the cost of day camp going to be in the upcoming summer season.
And that's what amount is that?
So day camp this year will be $310, which is a $20 increase over this past year. And the teen camp will be $340, also a $20 increase. We are still one of the more lower
That's
cost.
the fee.
That's the fee. Yes,
And is that for residents?
that is the resident fee.
And what is the
the,
non-resident? Because I know
the
we-
non-resident fee is $50 higher.
So, okay, so we do charge non-residents higher to come to our day camp. What is the fee for the after-school program going to be next year?
The after it's next year after school is basically we break it out by day, so it's $26 a day. Right now it's 25, so it's not going up as much.
Going up
on
$1 a day
cost, but it's
to do that.
but when you obviously calculate that out by 180 days, it's a little bit of an
So,
increase.
so really what we're saying is that the day camp is 310 for a resident. And granted, if you look around like the YMCA and other programs, they do not serve lunch. We serve lunch that is a USDA approved lunch with all the fixings and things of that sort that it's not a junk lunch. It's not a peanut butter and jelly sandwich. It's an actual lunch, chicken nuggets, salad, the whole 9 yards. So for 310, it's a great deal because parents don't have to worry about it's 102 degrees out there and I'm sending my kid with a bologna sandwich and is it going to be rancid by the time he eats it? So, but really those are the main points of the revolving fund is that we do charge for these. We do not charge an exorbitant amount. We're really just trying to break even on these programs with a little bit of extra money so that Matt can do new programs. So he has some seed money to start new programs up and things of that sort. And that's really what the revolving fund is for.
Right.
Okay?
That makes perfect sense.
And I think it's important that people understand that that allocation for administration costs does cover the expenses that the town incurs for administration, for salaries and all that kind of accounting and stuff like that.
We go in the summer because of the day camp. We could go from paying on average, say 250 people a week up to almost 400 people sometimes. It was almost that high, but usually, it's 50, around 300 from 250 to 300. But sometimes, it gets that much higher with lifeguards and, individuals because these people, some of them don't work a 40-hour week. We might have 4 people working the 40-hour week for a lifeguard or whatever. So it gets up there real quick. So yes, you're right. It does cover the cost of mostly finance and some of Matt's time because Matt has to stay down there all summer and make sure all this stuff is happening properly.
Working.
And I think, all the data that you provided us give us the details, but I think, Paul, you're right. The bottom line is what is it? Because obviously you are charging what you need to charge to be able to make it flush. So I don't feel a need to have many more details than what, because it's pretty obvious you did a good job of presenting all the data we need.
Is
Unless-
this revolving fund part of our budget approval every year?
No,
or-
it's not because it was only approved the first year. Once it's approved the first year, what a revolving fund says is that if you don't have money, you can't pay the people. So we have to have that money. So as in January, when all these, he said he had over 900, so they start paying, and that allows to keep the fund moving to pay for the summer help. So
Therefore, the
it
name
revolves.
revolving.
The money just keeps revolving over and over. So it's not part of the budget process, but we bring it up during the budget process for the simple fact we want to let the residents know what we do charge, and this program is still happening, and the town council to see what new programs, if any, Matt's looking to create.
And I bring that up because you have $687,000 in this budget, in this revolving account, which is used to provide services and it pays for itself. And so that's not in our, but we're not charging the taxpayers,
Correct.
$750,000 to provide recreational services for kids and adults and teenagers and things of that nature. So I think it's a great program. It's very well done. And I appreciate what you're working on, and thank you for it very much.
And just one other thing, you bringing up $750,000. I don't want to think the people that this gets audited
Oh, yeah.
during our audit. So
Oh,
it's
yeah.
not like it's this log account that's way out here in left field. No, when we come through, it's
Well
part of our
vetted.
financial audit, and the auditors look at it and make sure everything is legit.
Okay, thank you.
I don't have any questions for you. Anybody else?
No, I will just say this could be half as big and still be successful.
Yes.
And so appreciate everything you put into it, Matt. It's just amazing to me how this thing is growing, how you described how it's growing since you've taken it over. It's a really good service for the community. So thanks.
Anything else? No, I thank you. Thank you very much.
Thanks.
And congratulations for doing such a good job for us. Next, fire. And that starts out with, we're doing the fire.
03.
Tab 3.
023. Yes. So, this is Chief DeFranzo's, I believe, second budget with us.
Oh, so he's,
So he's old. He's an old pro.
He's an old hat now, yeah.
Trying to think, it might be our third, but
So we can take the gloves off.
absolutely.
Well, technically, you're second. You've been here 3 times, but technically, this is your second. The first one kind of was done for you.
Yeah.
And I do want
And
to
I was very lost.
say he also has one other member of his management team that's his muscle in the back is Assistant Chief Newman. That's told me he's going to sit in the back row and make sure.
oh, he wants to stay out of fire. He just wants to stay out of aim, that's all. Go right ahead.
Good evening, all. Thank you for having me and allowing me to present to you the fire department budget for hopefully 24, 25.
Hopefully.
Well, you have to approve it.
Well,
So if you don't approve it, we don't get it. So
you're
I'm
presenting
hoping-
the request.
I'm putting in the request. So, overall, and the town manager does a great job every year explaining exactly the direction he needs to give the department heads, and I take that seriously. We knew this year was going to be a pretty challenging financial year, so I'm always mindful of that, even if, he didn't make those words. We try to make sure that we ask for what we need. For the most part, we're pretty accurate with our estimates on what we want based on history. But every now and then you get a weird timing in, history, and it blows the curve. So we've done our best to come in as low as possible, but still providing the level of service that we think the citizens have come to want and expect from us. So I'm just going to brief the department, the budget, and then if you guys have pointed questions like we've done the last couple of years, you can ask me and we'll go through each line, whichever one you want to go through. Wages are pretty much contractual, so there was no adjustments there other than what the contract says we have to provide. You'll notice a decrease in wages in part-time. Those monies were actually shifted over to the overtime line account for the supervisors union to offset the increase because of the contractual rate that we have to pay them. Their overtime rate needs to go up to make the adjustment. So that's kind of like a level fund there.
Wait,
So that would have been
Say that
wages.
again, say that again?
say that again. You
All
said
right,
wages
so-
part-time went down
Yep.
by 20,000 and
Yep.
overtime's going up by
About
126,000.
Nope, that's a different line item. That's why I
Oh.
said the supervisor's overtime line item.
Which is 8105.
Yes.
Overtime supervisors. Okay.
So
All right,
that's-
thanks.
That's why I wanted to, yeah.
So
That's
it's
why I
just
said supervisor's overtime, because it's different.
swapped.
Okay, so that's how we covered the supervisor's overtime. The other maintenance supplies, obviously costs are gonna go up for things that we're gonna need to just maintain our operations. Postage went down, and then the big item, and we certainly can talk about it, is the overtime for the regular firefighter union group that we have. That overtime is a guesstimate to maintain the 11 firefighters that we currently have employed and to maintain the services that we provide every day.
Is that 8111?
Yes,
Yeah.
that would be 8111,
Okay.
correct.
Yeah.
Now, I know when the finance director presented all of you the half-year projections on what's going on with overtime and the expenses in town, obviously we stick out. And unfortunately, it's because of, I think, the way the overtime is used in our department. Right now, again, to maintain the 11, to maintain our services for us, a lot of that is shift coverage, so that we can keep 11 firefighters on at all times, again, to maintain that engine coverage, the ambulance coverage, the second ambulance coverage, the third ambulance coverage. and we've done very well at maintaining all of that. The other big number that comes out of that is holiday time and overtime. Those are the two big numbers that if you pull those out, we're not really using a lot of overtime hours for the other things that we do. Another big item that comes out of that is we have a few firefighters that are on workers' comp. So again, that's something that I can't control. So we have to cover those shifts to make sure we maintain that number of 11 that we think is the right number for us to operate efficiently and effectively in town.
But that is reflected in the workers' comp too,
Yes.
right?
Yes,
That's
this is
part of
one of
the
the only
increase.
departments that have gone up with workers' comp,
Right.
and that's
So
part
that
of it.
fits in with what you're talking.
Correct.
And we have done a lot, with lifts and the backs and the
Right.
the
chairs,
chairs
the
and the chairs
transporting.
and the power
Right.
stretchers and things of that
Yes.
sort. But we still have injuries of shoulders and tweaking of backs, lifting it up and down or what. They're still getting injured. It's just, it would be a lot worse if we didn't have that extra equipment. And the chief always looks at what he can do and what equipment he can buy to help
To
prevent some of
Or
those
is there a
backs
training
and-
program we can bring in and, keep people, engaged in how to make it safer before they do something that they may get injured? So we always look at everything that we can possibly do to minimize those injuries. Because trust me, the firefighters don't want to be injured and they don't want to be out of work. We don't want to have to keep them out of work. So it's just, if we can do something to minimize that, that's what we look to try to do.
But especially fighting a fire, you're not running into a safe environment to begin with, right?
No,
So, I
but
mean,
again, hopefully with the
the-
training and the education and the experience that we have, we minimize the risk in any potential injuries that may happen. Other than that, it's pretty much a level funded budget, other than what we think for increase in costs in areas that we really would like to control. But if someone tells me Band-Aids are going up 27 cents, well, I need the Band-Aids for the ambulance, so I got to pay the 27 cents. Keeping it general. So, but I will certainly answer any questions that you may have on any line item that you have a question on. We can certainly go through it.
The increases for uniforms, personal protective clothing and whatnot, is that?
Yeah, cost, so
What number is that, Paul?
That's 8204.
8204.
Okay, I get that too.
So uniforms, again, clothing costs, you try to buy a pair of pants today for us and it's crazy. And then also just, we've had a bunch of new hires come on, so we've had to cover those costs as well. The increase in the protective clothing that the firefighters wear has gone up almost $1,000 per set. So a coat now costs almost $2,000 and a pair of pants is $1,000. Whereas last year was probably
How long do those last?
10 years.
10 years.
10 years. Yes.
But with the additional firefighters,
Yep, we've had
that's the
to, yeah,
additional dressing them.
to make sure we keep 11, and then, we always want to make sure we have a few spare dollars in the account should somebody tear a set and it's not repairable, or they go to a situation and the tourniquet becomes destroyed, or they go to a petroleum type incident and we can't get it cleaned, we have to replace it. So again, it is an expense, but.
So
those are
you
the
asked
layers
for
of-
119,000, Paul, the town manager put it at 138, 139. Was that just because increases that you found, Paul, or
Yep. 8204.
8204?
Yeah, you were more generous.
Yeah, I think when Paul and I sat down and talked about it, we identified an area that I overlooked. So we made or he made the adjustment, or allowed us to make the adjustment with him.
And price increases you hadn't recognized, or,
Yes.
because his notes all say price increases, but
Right. I think it was the fire protection clothing is one line item. I think we only had 9. I think we added 3 there.
Yep.
And that was like $12,000 of that $19,000. And then there was another one that we had to adjust with a price increase as well on one of them, I think. Because we've been, it was price increases in total number of sets. When we were counting it, we looked at that. So he came to me and I said, yeah, okay, when we were going over the budget.
that's a tricky way to do it, put in a low number and
Yeah.
get the manager to take the,
So he
Yeah.
looks at it.
It is.
Yeah.
Sleight of hand, you're right.
Didn't take you long to learn that either.
No,
you know.
no. I come with a couple of days experience, yeah.
He probably came with that truck.
That's true.
Nancy?
Thank you. Hey, this is a question actually not related to the money, but what's the status of PFAS in your gear?
Unfortunately, there is PFAS in the gear that we have, and the manufacturers fully make us aware of that, and they also advise us to wear it as minimally as possible. Historically, a lot of guys used to just wear their bunker pants all around the fire stations or their turnout coats on calls that they may not really need to wear them. So now we've advised them, do not wear it unless you need to wear it, which minimizes that skin contact with the material. And again, even when we're using it, those materials can break down just wearing it, right? You know, your knees bend, your elbows bend. So you're breaking that fabric and material down, which can cause a problem, but it is what we have to wear for now. We minimize as much as we can.
It just concerns me.
It-
We've had
It
that-
is-
Are there even
I just-
alternatives, I
I-
guess?
Well, there are
A couple,
alternatives.
but they're
are
still being
alternatives.
tested, and trust me, I'm sure the manufacturers are working due diligence to get us something.
Yeah, it's just the occupational cancer in firefighters is so high.
It is.
And it's bad enough that they put themselves in
Right.
danger doing the job. But when you're wearing protective gear, that increases risk of pretty life impacting illness. We have to do better than this. So
Well, the
I
foam
don't know,
used to
it's
be
just a-
too, but we don't use the
Nope, the foam has been removed.
Yeah.
Yes,
The
Yeah,
gear
I remember we
still.
checked that out.
correct. Yep.
So the other thing I want to mention too in this fire department is that as of February 2025 in this budget, the SAFER grant goes away.
Right.
So the town's picking up some of those. We've always budgeted for those guys in the budget. I'm just
But you're
saying
gradually increasing
gradually
that, right?
increased it so that when the revenue goes away, it's not going to be this. Wasn't going to be a 19-cent jump on the tax rate because we put it in other areas and we're starting to pull back those other areas. But it's wanted to say that as of February 2025, the SAFER graph is no longer, and those 8 people that we had on the SAFER graph become 100% paid by the town of Merrimack.
Barbara?
Just a couple of questions, Chief.
Sure.
In 8203, line 184, CPAP, is that charge or that line item for the tubings? Because once you got the machine, you got the machine.
Yeah, let me just double check. 203. I don't know if I have a note. CPAP.
If you're getting a whole new setup, the tubing, that's about right.
That's what I was wondering.
Yeah.
So if you've got 10 replacements there
Right.
Yeah.
for the,
Okay. And what about the pulse ox?
My help in the back said that's for the disposable masks. So as we,
Okay, yeah.
we can't reuse those.
Right.
of course, okay.
And that's what I thought, but I figured I'd ask so people wouldn't think we're buying a new CPAP machine every time.
Right. Yeah. No, it's the supplies to operate the equipment. Correct.
Right, but I wonder about the pulse ox.
Mhm.
You went from 500 to 1,000, so are you buying new ones for every patient?
No, some of the supplies for those devices have become very pricey. So like the finger probes,
Yeah,
right? You know,
I have one, so.
yeah. Again, Assistant Chief Newman really manages that part of
See,
the
he
budget.
thought he was going to stay out of
Yeah,
it.
so he
Get out
certainly
here.
can
That's what I
answer much better than I can.
Shopping on Amazon.
Yeah, that's what I did, $25.
Good evening. So to answer that question is, it's not a one size fits all for us. So we have pediatric pulse oxes, we have infant, children, and we have adult. And so to manage the cost of that, they've of course, like everything else, has gone up, and we want to make sure that we're hitting our population that we're bringing in. So
Yeah, because,
in order to be that catch-all, we've had to increase those costs for.
yeah, it's kind of hard to put a pulse ox on a baby's finger.
Correct. So
Okay,
you're
just-
adding another set, and
Just-
the cost doesn't go down for it.
Okay, yeah, I was just wondering, and we still got Reed's Ferry going. There was something else in here, if you bear with me for just a sec. The Stryker, I'm sorry, 8336, maintenance other, line 296. It's for the Stryker stretcher and chair. What is that, has the service, the maintenance service gone up on it, or is that for replacement, or?
That's for the service of it.
with, because it's a automatic,
Hydraulic
yeah.
thing, yeah.
So that we have service for that. It's not just the regular stretcher. So we have maintenance comes in for inside the ambulance for the track system for it, and then the stretcher itself, because now it's battery operated, has all those components. It's there are times where that breaks down or gets jammed up with equipment or something along those
Yeah.
lines. So the cost to maintain that and keep it running up has increased. We also have our stair chairs through Stryker, so
Right.
it's kind of that bundle that we have, and it's just to keep those pieces going to help us.
So we have a maintenance contract on those?
That's correct. yep.
Okay. That answers the whole question. And down on 8406, emergency management, line 331, pallet water for emergency operations, and it went from 300 to 1,500. Oh,
Yeah, so
we're just
what we-
keeping water
yeah.
bottles on the
Well, that
trucks.
is, again, we do try to keep a pallet of water in the station at all times, not only for the firefighters, but should something happen in town, whether we need to open a warming
got
shelter,
water.
a cooling shelter, or anything else, we do have at least a cache of potable water that we can bring out to the public if we do need to do that. So that's what that money goes for.
Perfect, thank you.
Any other questions? Andy?
I want to go back to the overtime. 111. 124,000. If I look at the pay rate, that's roughly 2,700 hours. What happens if we don't fund that increase? What's the impact to the fire department?
So if we don't have enough in that overtime budget, I usually try to make adjustments internally and with the town manager to try to cover that. As you know, to keep it very basic, I need things and I need people. And the things don't work without people. So we try to make sure we keep as many people as we can working to maintain what we need to provide for services. If for some reason we're not able to make an adjustment and make that overtime coverage, then we're gonna have to drop. And I think that was something that was mentioned when you guys accepted the SAFER grant, was that you would drop to 10 if we were not able to do that. I try to do my level best to make sure we cover as much as we can. Because it's important. When somebody calls for an emergency vehicle, well, I don't really want to have to call mutual aid and wait whatever time frame that's going to be. Whereas if I'm able to manipulate and creatively find a way to come up with the dollars internally with my budget, then that's what we do. Does that answer the question?
It does. I guess I'm looking specifically, would we cut down at certain, are there good times that, hey, this day of the week, this time of the day, we could, drop down to 10?
I wish there was, but if you take a long string and look at the whole string, it's pretty equally across the board of when we get our calls. There's no like spikes between 8 and
Yeah.
4 because that's when the people are all in the businesses here in town, and at nighttime it drops off. That's not historically what we've seen. We've seen a pretty flat line across all times, all days. It is kind of curious to see when you look at that spreadsheet.
And for roughly 2,600 hours, that's a little bit over 1 man year, right? That's full time for just a little bit over 1 man year. Would it be cheaper to add an extra firefighter to cover some of these and pay him straight time versus paying firefighters full time or overtime?
I think that was a question that was researched when you guys were going for the SAFER grant. And I think it was cents on the dollar to go to 12 and then drop to 11 if we needed to.
So I
But
don't
I
mean
don't know what
12
the final
across the
decision.
board.
Yep.
I just mean an extra person, so you're not paying someone overtime. Overtime's not straight time, right?
No, it's time and a half.
So
The issue would be is that the fire department runs a 24-hour shift. So
It's four.
would be 4 to cover that.
It's 4 different shifts.
So if you do one, what
No,
shift do you put that person on to cut the overtime?
maybe I'm not making myself clear.
No, I do understand what you're trying to ask, but it's okay. Do we do a 124 because there's a contract for that? Because if we hire a firefighter, they would have to go underneath that union contract And in these terms of conditions of that union contract, it's a 24-hour. So who do we give the extra gentleman to, the extra firefighter to, and what shift is that?
I guess it's
Do we
the
do a
union,
rotation? Yeah, do we do a
union
rotation?
terms and conditions that would not allow us to take advantage of that. I guess I just struggle with, we said, here's the cost to go to 11, right? But here's the cost to go to 11 when we pay 11 firefighters straight time. Now we're paying 11 firefighters straight time and a 12th firefighter overtime.
When needed. When
Right.
needed.
When needed.
And you got to remember.
Well, at 2,600 hours, that's a full year. I mean, that's over a full man year.
Right. And you have 36 individuals in that line item that are eligible for that overtime in 8111. So 3 years ago, when we started the Safer program, a lot of those guys didn't have leave. Now they're starting to accumulate some leave after 3 years, and they're taking their vacation time. They get sick, they take some sick time. And that's really what we're covering on the station shift coverage. If you look at station shift coverage, it's 8,800 hours. Just for station shift coverage for vacation, sick, and personal time. And I have a spreadsheet that goes back to 2009 that we use for averages
That's right.
of sick time, vacation time. Personal time is 48 hours. That's per firefighter, and that's a standard block. But we go through and we use the average over a 13-year period, or even now it's 2009, so it's a little bit more than 13 years that we use this average to come up with, this is how many hours they have used on average on vacation time and sick time. And when we look at sick time, and if a gentleman is out on workers' comp or something like that, we take that out of the equation because that would just skew your sick numbers. So there's this spreadsheet that does this, and then I take 75% of vacation time earned because not every guy is going to use 100% of his time. So that's how we look at these things. And that's wanted to come up and say to fund 211 firefighters right now, the estimated cost rate is $626,000.
Yeah, we basically, if we approve this overtime budget, we're adding another salaried position to the fire department. That's basically 124,000. That's
Roughly-
basically what
yeah,
we're
roughly. I think a firefighter is $150,000 fully costed out.
Which was part of the discussion we had when we talked about the 4 additional. And the whole idea about manning to 11. And at what point do we talk about, because I remember the discussion, there would be overtime because people had vacation. But if we set the bar at 11, then we are acknowledging that when any one of those 11 is out, it's being replaced, and that's overtime. And that replacement can be because of sick leave or personal time or whatever it is. But I remember having that discussion at one
But
point.
we also put the stipulation on that we would man to 11 as long as the overtime budget held.
That's correct, and that's the point.
And so now we're saying
What do we call
we're going
held?
to increase the overtime budget to make sure we man 11 across the year.
And what,
I'm not 100% convinced I'm there. I'm not convinced I'm not. I may bring this back up again when we meet on the 25th.
Right.
Think about it.
But I wanted to provide the cost associated with manning
Right.
to 11 for a full year.
right, so we could have the discussion.
Correct.
Barbara?
So over the last year, we've had the apartments at 360, Merrimack 360 open. We've had One Innovation Way open. We've had the apartments at Slate open, and they still have a few vacancies. Is 11 still a decent number?
No. To be honest.
And I'm sorry to
No.
ask that question, but
No,
knowing,
I mean,
that's what the planning board tells me, is that I know how many are opening and coming.
right. I mean, to be honest, I mean, if you want to follow the NFPA standard, we should have 4 guys on an engine. We have 3. Station 2, we're using 3 guys to cover an engine or an ambulance. So it's one or the other. We can't do both. So we're already cross-staffing equipment to make it workable as effectively and as efficiently and cost effectively as possible. So if we get a second ambulance call, a piece of equipment's not gonna go on the road, whether it's the ladder because we're gonna use ambulance 3, or it's engine 2 because we're gonna use ambulance 2. So we lose something when we get multiple calls at the same time. If you wanted to staff properly, we should have 3 ambulances with 2 people each, 2 engines with 4 guys each, and a ladder with a 4-man crew. That's very expensive. So we've done our best to calculate the efficiencies of our organization and what can we afford to do to maintain the level of service for the call volume that we have. And since my time here, Manning to 11, we have covered almost every single call that we get. Our mutual aid requests are not what they used to be.
That's just, I was just gonna, I have mutual aid written down here. Part of the rationale, when we had the discussion about adding the 4, we got all this data about mutual aid, and we were getting a lot of mutual aid.
Yes.
Now, my question is, one, that's less, right?
Yes, it is.
Are we being called for mutual aid to help other people?
We are. And it's
And is
not
that-
like it all goes to one community either. We've been able to help other communities when they've asked for help. And history, again, from what I'm told, because I wasn't here 3 years ago, but we may not have always been able to help out a neighboring community because we didn't have the people.
Correct. So proportionally, what do you think it is now? I mean,
I would say, looking at the numbers that I got, and only did a 6-month window, we received mutual aid 15 times. We gave mutual aid 64 times in a 6-month window.
And out of those 64 times, how many were ambulance?
I don't know if I ran that number, but it's obviously way more EMS response than it is fire response.
because we get reimbursed for that, right?
Correct. Every single ambulance call that goes out.
Oh, we have hand signals in the back.
Yeah.
So out of those 54 calls, let's say, even if it's 50% out of those 54 calls, 27 of them, we're actually getting paid to transport those people to it.
But it has to be said, that also makes that person unavailable to
To the
us.
town of Merrimack, correct,
So that's
correct.
a certain amount of cost that we have to.
And it's not one person, it's a minimum of 2, right?
Correct.
On an ambulance.
Correct. You're absolutely right.
It depends, not to get into Chief's business here because he can explain it a heck of a lot more than I can, but just remember looking at those charts, you know, an ALS call could be 3 people, it could be 6 people depending on the call.
Yeah.
A simple BLS might be 2 people.
It's certainly 2 people. And the more
You know.
complex the call, the more people it's going to take to manage that event because there's just so much going
Car
on. It's a very
accident
complex
versus-
call.
Yeah. So that'll be up for future discussion, is what you're saying, Andy.
I'm gonna give it some thought.
Yeah.
I don't.
I understand.
I don't disagree with you. Can I
Go
go
ahead,
back to
Tom.
maintenance, other 8336? The 19,950, is that just for ongoing support contracts now? I mean, we went up from 4,000 we actualed in 22, 23. We've leveled off now at 19,950 for last year, for this current year and for next year.
Right, because we have some contracts that we locked in for the next few years.
But that's, I mean, it's a pretty big increase, but that's for contractual maintenance. of
Correct. Yeah,
some
again,
of
because
the-
we added those powered stair chairs. We added those power lift stretcher systems, which we didn't have before. Again, we bought those items to decrease injuries, but with those things came costs to maintain them.
And when we bought the SCBA breathing apparatus, the testing, when we bought them, the apparatus to fill the machines, we rolled in a couple of years of maintenance and now we have to pay for that maintenance in this budget. And that's really the same thing with the Stryker stretchers and chairs that he said. When we buy them, we try to buy a couple of years or 3 years of maintenance on the front end and then they come due and, you know, so we try to, that's why it's 4 and it's going to go up roughly to 19. I can get you the cost of where we're at right now in the 23-24 budget. I don't have that with me, but we can get you the cost where we're at right now in the budget for those items.
Oh, okay.
Anything else?
No.
Okay, I have 2 questions. we've had firefighters come before the town council
Sure.
and had expressed concerns about the communication issues.
Yes.
They were told at the time they should go talk to you. Did they go talk to you?
Yes.
Okay.
Yes.
So the next question is there something the town council should be doing?
I know our administration and the town manager's office are working diligently to try to get something accomplished with the tower site, and I know we're like super close to finishing that up and moving on. I know that I don't have the time and effort and nor the expertise to keep managing the communications things that are going to need to be continued as we go forward with this new 800 system. I had it in my budget to hire an IT/communications person. Paul recommended it be moved over to general government in the IT division.
Okay, you meant, that's right. That is
So,
a position.
Yeah,
Okay.
because again, we're moving to MDTs. I was here a couple of weeks ago asking for more money to buy MDTs, right? Well, that's communications equipment.
Okay.
The police are going to body cams, right? So that's even going to be more equipment. The two gentlemen that we have now are awesome and great and do a phenomenal job, but I don't think they're going to be able to keep up with the demands as we need these communications things to do our job more efficiently and better. It's only going to get more complicated and worse as we start to really heavily rely on these pieces of equipment that we didn't have before, which is really going to be great to have, but we're going to need somebody to help us maintain it. And it's going to have to be someone outside the organization. So we thought it best to, what can we do internally or even externally with the town to figure this out? So Paul recommended moving it over to the IT department.
So your identified need of an additional IT person would be fulfilled with that.
Mhm.
Correct. Okay.
Yeah, as long as, we had asked for someone that has hopefully a communications background to help us with some of the radio equipment we have to help take the pressure off Nashua.
And you have radios, if I remember correctly. Didn't we order radios?
We got them on a grant.
Right, but we haven't received them yet, right?
No, that is.
Because that
that's
was supposed
something
to
else.
greatly enhance the
Correct.
power.
We've purchased.
And when did we order those?
Go ahead, Chief.
May zone.
May,
May.
and we haven't got them yet.
No.
So we identified that as a need way back in May. We
Correct.
did it,
Correct.
but you haven't received them
No.
yet. And that would help
Oh,
with
immensely.
that communication
Absolutely.
issue. Okay.
Yeah. Again,
So that's something that's been done.
correct.
Okay.
Everything that we've tried to improve communications, we've hit a roadblock, not of our own doing, whether it's the supply chain or legal issues or other outside influences. We've been hit with roadblocks that we just are working through to try to finish and get to the end.
And we've actually brought on 2 consultants
Mhm.
to help with some of these communication issues to see if it's equipment related, for one, and the other gentleman is the other issue with communication and getting the information to fire. So we brought on one for the communication piece, the talking piece of how things are dispatched to a fire department, because language is different between police and fire.
Right.
They use different language. So we brought somebody on to look at our overall process of that, as well as somebody to look at our hard communication issue,
Hardware.
the hardware versus the peopleware, for lack of a better term. So we brought those 2 consultants on, and they should be starting to give us some more information as well.
Okay, so you've hired consultants to help isolate the hardware and the procedure process. Okay.
Yeah, and we've done that just recently,
Okay.
as well as what the chief has said, that, we're running into roadblocks with some, just
Yeah.
getting this
Just-
stuff
Oh,
here.
well, I remember the radios being ordered,
Yes.
and it's like whenever I found out they hadn't been, well, we can't make them. They just. Do we have a timeline on them?
No.
So-
I've asked the sales rep and I got a question that he needed more information. I sent it back and I've heard nothing, and that was right around Christmas time, so. Yeah, he did look it up and found that they should have been delivered to us sometime in November, but he did not have an answer as to why we don't have them and when they're even gonna be delivered, so. Well, the company is who the company is, and they kind of have a cornered market, so there's no rush for them. And I hate to say that, but that's where we're at.
Right.
When you're
Right.
secluded to one particular vendor, in
Right.
one particular marketplace.
Sole source, that's the disadvantage.
We're at their mercy.
Okay, well, you answered my question, thank you.
Okay.
Tom?
So one other question, while we're here, capital reserve funds is rising 135,000.
Yeah, we can talk about that when we go over the capital reserve funds, or we can talk about it now.
Well,
Cost of equipment, cost of an ambulance, the chief can tell you, cost of an ambulance went through the roof. Cost of a fire truck is what we got for 695,000, chief, is now.
Yeah, the two trucks that you bought 3 years ago for about $1 million, it's almost gonna cost you $1 million to buy one. And then an ambulance, the contracts we signed 2 years ago for like 250, an ambulance today is probably gonna cost you almost 400,000. And that's
And-
only in 2 years, 3 years. Things have almost doubled in price.
Now, did I hear there's only the manufacturer, there's less manufacturer now?
I
There used to
don't
be
know.
2, 3, and now there's only 2, which is adding to the,
I haven't heard that. Obviously the big ones are Ford, Dodge, and Chevy, right? Those are the big manufacturers of cabs and chassis for the EMS world. And as far as I know, they're all making chassis for EMS vehicles. It's just, they can't.
It's the
make them
engines
fast
though,
enough.
right, chief, for the
Some of the engine
Detroit
components.
diesel versus
Now that's the
Cummins?
bigger trucks.
Oh.
The bigger trucks, there's really only one manufacturer of an engine for big equipment that will go over the road.
because Ford doesn't make diesel, I don't think.
No, not for the larger engines
Right.
that I know of. I mean, it's what I get told by the sales reps, and I usually try to do my homework, and they've been pretty accurate so far. But nobody wants to do the over-the-road stuff and meet the new emission standards. They don't want to be bothered.
Right, that's right.
So that's why the increase in the capital reserve fund for both ambulance and fire equipment.
Future costs for
Future costs.
replacement equipment. is
Right,
just gonna
actually,
be-
it's really just in the ambulance section of the capital reserve fund. The fire section of capital reserve fund, we said $400,000. We're still flatlining that at 400, but the ambulance went up to 250 to meet the rising cost of an ambulance that is going to be due in 2 years.
Yeah, we have one on order that we should have got
Yeah, I was
a
just
year
gonna
or
ask
two
that.
ago. We have another one on order that we should have gotten now, and we don't have it. And yeah, probably in another year or two, I need another ambulance, and we're just. I don't
So
have 'em.
getting in the queue was really like a 2-year wait.
Yeah, correct. Yes.
Unbelievable.
And at least originally we got in the queue at a certain price number. If we were to get in the queue today, from what we're told, they won't give you a number.
Yeah, the
So
previous
you don't know
ones
what it's
we've
going to
got.
cost when it comes out the other end,
And
which I don't think is fair, but
From the
that's,
time you order to the time you actually, yeah.
And I think Londonderry just bought or was going to buy a new pumper truck, and in their contract they put in a 28% escalation clause. So they gave them a number and said could be 28% higher, and when you get it, so they're putting in escalation clauses these companies now as well, versus when we bought our ladder truck, it was $1.5 million. We're still waiting for it.
But
We're hoping it's
still
coming in June.
1.5.
It's still 1.5. Today for that same ladder truck is over how
almost
much?
$2 million.
Almost $2 million. So, and
When did we order it? 2 years ago?
it's
Yeah,
about 2 years
about-
ago, right?
Absolutely.
Just for fun, I Googled how much does a fire truck cost? And it says for a ladder truck.
Yep.
Yep. In 2021, it would cost about 1.6 mil. The final price for 2024 is running around 2.2 mil, which is like a 36% increase. They're not coming cheap anymore.
Well, thank God we ordered when we
never
did.
did.
Correct. Yes,
The ones we
absolutely.
did do.
And we've got an engine on order that
We don't have them yet.
Nope.
but-
but we're in the queue. We locked in a number, so we've done our due diligence to save as much money as we can. It's still an outrageous number, but you just learned
Yeah.
if we waited and said we want to buy a truck today,
Yep.
the cost is just crazy.
Right.
And that was with Pierce Manufacturing.
Yes, and that's who makes the trucks
Yep.
that we're
That's
purchasing.
right.
Yes.
Because I recognize that name.
Yeah, so the capital reserves that went up the 35,000 dollars was for the ambulance,
Just for the ambulance.
just for the ambulance capital reserves, so that we can get one in 2 years or get in the queue in a year and a half to get one in 2 years after that. So
And every other town in the country must be in the same boat.
Oh, they
don't
are, absolutely.
Yep.
Yep.
what did you say, Chief? AEV's making 28 a day?
Yeah, the company that we're purchasing the vehicle from, they make like 26 or 28 trucks a day.
So,
They probably could do more, but what we're told is they can't get the supplies, they can't get the materials, and they don't have the workforce.
Yeah. all
Nobody
that.
wants to do that job anymore.
Mm-hmm.
And then the cab manufacturers are not coming off the line as quickly as they would like.
Well, can't do it remotely.
they're pushing 140 ambulances out roughly a week. And we're still 2 years back.
Still can't keep up.
And that's just one manufacturer. There's many manufacturers of ambulances.
Yeah.
It's got to be at least a dozen.
Any other questions? Okay, so could we move on to code enforcement now? Is that the next one?
Yep.
Okay, number 6.
Code enforcement is pretty much a flat level budget. Last year, we asked for software for that department, and we did get it, so there was no additional costs that we needed this year because we rolled in the maintenance costs and the other costs that go along with the software into that original purchase price. So we really didn't need any additional extra monies for the code enforcement division.
Everyone's pondering. Any questions? Seeing none?
Like some of the other ones, there's not much you can ask
Yeah,
about.
really.
You know,
Okay, so actually we're done with the fire, right?
Yep.
Because we go on to proposed issuance of debt now.
At this time,
You don't have too many scars.
Yes, no. Thank you.
thanks, chief. Yeah,
at this
thank you.
time, I am not proposing issuing any debt. We're still in negotiations for land for the safety complex. So it's not prudent to propose funding
Anything
that
until
at
you
this
know what you
time.
got. Yep.
Maybe if I can get it by next Thursday, a signed document, then next Thursday I might be proposing something. But at this time, I'm not proposing any issuance of debt for our safety complex, even though we do have numbers and we do know how much it technically might cost us for the safety complex. It's just, I can't put a warrant article on for a safety complex if I don't know where it's going.
Do you want to explain what that means, issuance?
Sure. Issuance of debt is the town going out and actually bonding, taking out a bond to pay for something over a number of period of years. So,
We're gonna give her a blanket. We're gonna have a blanket here.
Is she got her
She's got
coat
her
on.
winter coat on. God bless her. I'm
You can
sorry,
get
I
a
didn't
little
mean to.
heater thing.
I didn't
yeah.
mean to interrupt, but I couldn't resist.
no, that's fine. But that's what proposal issuance of debt is to propose a bond warrant article to go out over a number of years to pay for a piece of equipment or a building or infrastructure. And right now, we do not have any proposed issuance of debt. The biggest proposed issuance of debt that we would have is the safety complex that we've been looking at. Underneath the general fund, I have one bond outstanding, and that is for the highway garage building. And that's the only debt that I have there. In wastewater, I have a couple of bonds outstanding. I have phase 3, 4, 5 of the upgrade would be coming due in 25, 26. And then we have a dewatering bond that's that we're paying off right now, which is the old to help with the dewatering system that should be paid off in a couple more years. So
Those are paid for
by a sewer fund. Yeah, sewer fund. Those are those would not there. If you want to turn to tab 27 real quick.
Or as quickly as you can.
Basically, it's what I said right now is that we got a garage highway bond that's about $236,000 a year to include interest. And then in 31, tab 31. Where's tab 31? Oh, there it is. The bonds are. Yes, sir. Skip it right there. The bonds are for Compost, and phase two of compost is $431,000. So it was the phase two upgrade. We paid off the dewatering bond this year. So it's just compost and phase two, bond of the project previous is $431,000 a year. So technically, the town only really has two issues of bonds that are outstanding, one for sewer and one for general fund. Moving on to capital reserve. While we're here, I'm going to skip capital reserve. Let's go to tab 33, which is fire protection. Basically, this is for Pennachuck Waterworks. We have they supply hydrants in the southeastern section of town down by
The South Fire
so-
Station.
No, down by the YMCA in that area.
Over along DW.
DW Highway,
okay.
down past Anheuser-Busch, down in that area. So there's hydrants there.
Innovation.
That is Innovation Way, that Manchester Street in that area. The residents of those areas get paid, to actually pay this. They get a hydrant tax, so to speak, on the bill. And this is, but I have to pay the bill, and in the state of New Hampshire, we have to gross appropriate. So I have to bring this in as a budgeted warrant item, warrant article, part of the budget. And then we receive revenues to offset that. So really, this fire protection is tax neutral for most of the people in town. If you live in that area, there's a tax. They have hydrant service and fire protection services. Excuse me. And the last thing right now is the debt service. So if you go to the tab that says CRF,
You mean capital reserve?
Capital Reserve Funds, yes, sorry. It's been a long week already, I'm
Oh, I
sorry.
understand. I have empathy.
Where is
So,
that tab?
It's
45?
it's
No.
up front in the, if you're in the
Okay.
spreadsheet,
It's a third
Excel, it
tab.
says capital, yeah, but if you're in the spreadsheet, it says Capital Reserve Funding, CRF funding. If you're
CRF
using the
funding.
computer program. Okay. And basically what we're looking at, and I'll go over it real quick, is that for computer capital reserve, it's going up from $35,000 to $95,000. And that's really just the cost of all these additional softwares. And we've been running really a streamlined budget with our computer equipment, but some of our computer equipment, some of our switches are getting old, long in the tooth. And to replace them is going to cost some money. So we have to start planning on doing some of those replacements in the next few years. So there's $65,000, $60,000 that went up there. Valuation went from 17,250 to 20, so it went up about $2,750, and that's to get more in line with the revaluation that's going to be coming up in the next, I hate to say this, 2 to 3 years on town. I can't believe it's already been it's actually 2 years away. Revaluation's 2 years away. We did it 3 years ago already. So trying to get that money there. We kind of hit on the ambulance capital reserve fund. The capital reserve fund for telecommunications or dispatch, we're decreasing by $45,000 because the goal looking forward and going out, hopefully with that, we the fire chief talked a little bit about body cams. We're looking to get a federal grant to buy some body cams. So that's decreasing a little bit. The capital reserve fund, road infrastructure in 01, 08, 85, 10 increased from $595 to $700,000. That's due to rising cost of labor and construction materials to pay for all those projects we have coming up in the CIP. And DW Highway, to pave DW Highway, we were putting $50,000 in. Looking at what we did in the section from Greeley Street up to basically the Rite Aid Plaza, it cost us a little bit more money than what we were saving. So now we have to pave the second portion, which would be from Front Street over to Bedford Road. Is we figured it's going to be about $75,000, so we upped that about $25,000 there. For those capital reserve funds, solid waste, we left alone. Athletic fields, we increased both athletic fields and playground equipment. The playground equipment capital reserve fund, we have some playgrounds that are coming due to be upfitted again. We were fortunate enough that the Bice Field playground, the last time we were going to do a playground, the Rotary took that over
Right.
and actually fundraise for that. But we have the Norma French playground, which is at Wasserman Park. That's getting old and we need to replace some of the stuff. So we have not funded this for a while. So that's to fund it to start looking at some of those repairs in the future based on the CIP, as well as the athletic field capital reserve fund, looking at, and those should say, instead of 25,000, those should both say $10,000 each in the spreadsheet. They're not 25 there. I funded them at $10,000 each, for a total of $20,000. The department was looking to fund them at 25. I knocked it down to 10.
Which one was that, Paul?
Both the athletic field capital 0113 8510.
So instead of 50, it's 20,000.
It's 20, yes,
Yeah, but
That's
it says
fine.
20 in the budget.
in the budget, but,
Under yours, yeah.
but the
Okay.
backup shows 25.
Gotcha.
That was the department request.
That's right.
Those should say 10, and that's to start getting the money moving forward there. Library is 75 is the same. GIS, knocked that down from 20, up. Department's asking for 20. I knocked it down to 10. It's up from $5,000. We have some money set aside there. Really, that is for the flyover that we do every so many years. I think the last time we did it was like 2015, 16 in that time frame. So we're looking at 25, 26 to do it. So, and, but that general fund comes out to $2,250,000. An increase from $1,947,000. And then capital reserve for wastewater is 550. Total is $2,800,000 total for capital reserve funds. If you look at the tax rate for capital reserve funds, it's roughly would be about 45 cents on the tax rate for the capital reserves, an increase of about 5 cents. And that really is because, as you know, you hear it all the time when departments are coming in here, is that we budgeted X number of dollars, but we going out to bid and the cost is more. So we're just trying to get some money back. And by funding these capital reserve funds, these savings account deposits, it saves the town money in the long run. With instead of having to go out to bond, we were fortunate enough not to bond the fire truck $1.5 million. If we were looking at that same fire truck today, we'd be bonding $2 million for the fire truck, because there was no way that we could save. We'd have to start putting $75,000 a year away just to save for that fire truck, that ladder truck. So that is all that I have for the budget. If there is no questions, I'd be happy to answer any questions, I should say.
I don't see anybody having questions. So, in terms of finalizing next week,
Yep.
my understanding is we're not going to do the 24th. We are going to do the 25th as a regular town council meeting starting at 7 p.m. It'll include agenda for town council, but also the finalizing
Of the budget.
of the budget. Is that right?
And not that meeting, we'll be taking motions to move items to the public hearing. No, yes, the public hearing. Sorry, it's been a long week. Oh, once again, sorry. We'll be taking, I can't believe we're already done budget season for the most part with the presentations. But yeah, we'll be moving stuff to the public hearing for the 15th. So that was what we'll be doing, as well as other items. I do have one, there was a couple items that were hanging from discussions, and I just want to talk. The police chief, I asked him tonight if our police dog Dre, has a vest, and the answer is no. If he needed a vest or goes into a situation with a vest, they wouldn't be sending the dog in, he said. So we do not have a vest for the dog. But if it's if he gets put into that situation, he wouldn't go. Not to say that if his handler is being attacked with a knife or a gun, the dog wouldn't just jump in and go after him. But not so that we need to get a vest for him, because they're not. I'll read you exactly what the police chief said, because I'm not going to paraphrase it right. Sorry. He's been offered, the dog's been offered multiple vests, but they're just not practical. If it was a situation that needed a vest, he would not be deployed. So then I guess they're not practical for him to have it on and do what he needs to do. I will still get you that information for next week, next Thursday, about solid waste and the recycling cost. I believe that's all the questions that we had outstanding during the budget process. The one thing I do ask is, if you're looking to cut a position or add a position, if you can get me the information in advance, this way I can do some calculations.
And see the
i.e. Adam,
impact.
to see the impact of those. That'd be great. And I will be bringing forward, through some of the discussions we've had, I'll be bringing forward some reductions to the budget that I presented back in December. And we'll go from there and move forward, I take it.
Barbara?
Yeah, and so just for calculation's sake, 70,000 is still 1 cent on the tax bill?
About $50,000 is 1 cent on the tax
Okay.
base. So for every 50, it's about 1 cent. Now, just know though that there might be items that we might be thinking of reducing, and this is the other thing, if you have reductions, just so that I know that if there's offsetting revenues as well. So we're just, and there just need to be aware that there might be some items that might be an offsetting revenue.
Like with the wastewater.
Wastewater, media, fire protection, and
Parks and Rec.
Parks and Rec, police outside detail, fire outside detail, things of that sort. If there's a reduction there, if there's a reduction in revenue as well. So, you know, it's a zero tax on it.
Things like the police outside detail is always a difficult one, because if you don't budget enough of it and you need more, you have to take it out of our budget because we're gross budgeted, right?
Right.
So
Yeah, you can't expend. I cannot expend my total
Anything that wasn't
appropriations. And right now, this total appropriations of this budget is. Hold on, one more. $42 million, almost 42,680,000 is what I presented in December. So that's what we have. And if we reduce, like you said, if we reduce outside detail, it has to come out of someplace else, because I cannot overspend what I have.
That doesn't include the 100,000 that you're gonna be taking off.
Well, I'm just saying,
That's
in
literally
December,
what we had till
in
now.
December, this is the numbers that
Yeah,
came forward
to
in
start with.
December to start with.
Gotcha. Any other questions? Seeing none, done a lot of work.
motion to adjourn.
Motion by Tom Koenig, seconded by Nancy Murphy. All those in favor say aye.
Aye.
Aye. Any opposed? How dare you? None. Okay. And that has passed for 600. Thank you and good night.